So hey everyone, this is Michael. Oh yeah, there we go, we're in this camera. We're yeah, up there. So today we've got the lovely Michael Huxley. We're blessed with his presence. Lord, do you say Lord?
You call me what you want as long as you call me.
So Lord Huxley's here. He's stoked. He's had some veneers in the past, and so we're going to be working through what it looks like in the future today, where we're going to hopefully be able to do all of his veneers again in a single visit, which is actually pretty exciting. So we're both excited about that. Let's go through and just explain the planning and what we've done. Actually, we'll numb you up first. Let's numb you up first, and then we'll go through the plan.
Awesome. So step one, you need to be really comfortable before you get in the chair. You'll notice I've got a big puffy jacket on. It's like laying in bed. Literally like laying in bed.
If you've got the puffy jacket, then you're going to be totally fine.
Okay.
How's that? Is that comfy?
Yeah, lovely.
Comfy boy.
Do you want me to put these matrix glasses on?
Go for it. Okay. I'm going to start on the right for you today. Whew. There you go, mate. You all right?
Mm-hmm.
I'll get another one here. Thanks, Alice. You still keen to get these tidied up down here?
Mm-hmm.
Excellent. So we had a Zoom call yesterday.
Mm-hmm.
My kids were in on it too. Finn and Aria, they were loving it. That looks pretty bright, Charlie. Looks a bit, yeah, that's better. Much better. So I'll just use this other one so you don't have to keep changing the exposure. Yeah, that's fine. Cool, man. Sweet. How you doing? You feeling all right there?
Yeah.
Cool, cool. I will scoot you up. Nice and numb. That's
Yeah.
good.
Well, yeah.
Numb as you can be. Just leave you there, so you're still in the shot. So I'll just show like where we've sort of come and where we're kind of going. This will be good for you as well, just to be sure, in case there's anything you want to change last minute. But basically, these are the things like we're unsatisfactory with the existing shape of the veneers. That's what you said. You said this is the thing you've always said, the dark sides of the smile. And then the other thing we identified is that the canines you felt were a little bit angular when we were looking at yours.
Yeah.
So basically, we just collected consistent records. That's really, really important, because if you smile, you know, with your chin in one position and chin in another, we can't really know where objective is. And then there's some software that we use to kind of try and plan what would be different, because if you look at your teeth, there's not, like, from the front in this view in particular, a lot of people wouldn't think that there's much like wrong. But if you were to smile wider than what you're doing now, and you've almost refined your smile to be as small as it can be,
Yeah,
like
absolutely.
you've almost like learnt how to smile like that, you can see, and you can only just see it, but they're in these side areas here. These are called buccal corridors. And so they are quite dark, and we see it like a lot of people have, you know, do things like they'll put in fillers or whatever to try and reduce how, you know, that area. And it's more prominent for you because you had the 6 veneers done on the front. So even just by adding a couple at the back, it'd be fine. But if you've elected to, you know, redo them all, so that's the other option. The other thing that I think we're going to really see here is a big improvement because of these two things. So when some people smile, you don't see very much of the top gum, but I got this, you're not going to like this, but this was one of the first photos. So Michael had 2 sets of photos with me, and the first set he didn't like, and then he made me redo them, so that's fine. But this is one of the cheeky first ones, so I'm actually using it for planning because it's really, really good. He gave me a really full smile. He sort of let some of his training down of his smile. And there's a lot of gum there. So what we know from aesthetic proportions is that length and width are really, really important. And so in your case, we want to make sure that we restore a bit more length because we're nearly at the same height to length ratio. It's almost the same. I think it's about 9 and 10 or 9 and 10.5 millimeters. And then the other thing is that this lateral incisor is quite narrow. It's that red box compared to the white box, which is this extra amount here. So that matters. It's not the biggest deal, but what it does is it gives you this big sort of void between the canine and the lateral incisor. So if we can push that out a bit more with these new veneers, that'll be good. Now, some people would say, oh, well, why can't you just replace this veneer? Why can't you just do a gingivectomy, see how things go? But that's not Michael's style. And so
I think because if you did that, then you won't have consistency across the whole smile.
That's the thing. Well, certainly this one here, we can't ever make, you know, the other veneers to be the exact same as this one. We could look up and try and get the exact same ceramic, but age-wise, they're placed at different times. How long ago did you have these done?
Oh, yeah, like quite some time ago.
Yeah, right.
Like 9 years ago.
Yeah.
No, longer.
Longer. Well, the other thing is that, like, what are you laughing at?
It was ages ago.
Long time.
I was 21.
Yeah, right.
I'm 33 now, guys. So. Gives me thinking I'm younger than I am.
So, those are the corridors that we've talked about already. We've got the lack of tertiary anatomy, so if we look at like your teeth, they're all very, very, they're a nice light colour, but they look a bit dull, and the reason for that is that you don't get light reflection and refraction. So what we want to see in these areas is a bit more texture so that the teeth don't have such a dull look, and we'll be able to achieve that, which will be good. We also had some decay, so we're going to get rid of that at the same time. And this is just some of the planning that goes into arranging the case. So what we're going to be able to do today is actually do what's called a gingivectomy. So we're going to be taking, you know, a small amount of gum tissue basically off all of these teeth, and that's going to restore that ideal aesthetic proportion, so length to width of the teeth. It's important to plan that in advance because if you don't, you might, you know, we might start hacking up here. Probably would be bad. And this is just a simulation, so it doesn't look like too bad, probably doesn't look too good either. It's just done by a computer, but hopefully we'll be able to give you something like that.
Yeah, I think for me, like, you know, like we've spoken about, I've always liked the length of the current teeth. I think that actually looks quite good.
Yeah, I agree. That's why we've in that
like
shot.
That height factor, because I'm still quite gummy, and like I said, like I've adjusted my smile over the years.
Yeah.
To actually, you know, take that.
Yeah. No, that's it. And you can see it, like when I'm taking the photos, that was one of the first things I saw. All right, so we're going to get into it. First thing we're going to do is we're going to do this gingivectomy, and then we'll take a couple of insurance impressions in case we have a power outage and we need to give you some temporaries, and then we'll get into the preparations. Just going to give you another little injection on the other side.
So it looks like Dr. Murray's injecting Mike with some articaine there. Articaine's a really popular dental anaesthetic. Really long lasting, soaks nicely through to the nerves of the teeth and makes you really numb, and means the procedure can be done in complete comfort.
Just get that ant bite moment. When that's done, you're pretty much okay.
Special thing about articaine is it actually is really good at soaking through the bones of the mouth, be it the upper jaw or lower jaw.
All right. How you feeling?
Mm-hmm.
You good?
Good.
Very good. Okay.
Yeah, I'm very comfortable with as much numbing as you want.
Do we
Pump me
have
up.
the other one of those? One that's got a few more notches.
Am I able to also suck up some
You want
of
to?
it?
Yeah. Tastes pretty good.
Thank you.
The other thing that we didn't talk about yet is that you wanted to, we talked about this on the Zoom yesterday, is that you wanted to show a little bit more of these ones. So I've already done some bone sounding for Michael previously when we had our other consultations, and so we've got like 4 to 5 millimeters here before we need to be concerned about invading biologic width. That's a technical thing for dentists, not so much for patients, but we're gonna get started now. Just slight. I'm going to need another scalpel in a second. So with your gingivectomy, you really don't want to be doing multiple passes on the tissue, ideally. So sometimes we need to get another blade. Yeah, I'll get another one. If you can change that one for me.
So Dr. Murray's doing a procedure at the moment called a gingivectomy. The gingiva is a technical term for the gum. So gingivectomy as in removal of some of the gum, and that just means the full face of the tooth is going to be a little bit more visible, and also means the full face of the veneer that's bonded to it will also be a little bit more visible.
And Michael's not getting veneers on these lower ones, but he was a bit concerned that there was less of these lower central incisors visible.
Yeah.
And so we're just making a little adjustment to those. And we're being a little more conservative than... We can always round that out more if we actually need to, so...
Yeah, just restoring the golden ratio. Is that what it's called, Dr. Murray?
Well, this is more just Michael's preference for those lowers, because when he smiles so close together, you see when Michael, I should have got you to do that before, but now you can actually see some of those lower teeth for each one.
Yeah,
that
perfect.
camera angle actually comes up and underneath a little bit, but before, when it was from the top down, you actually couldn't see the whites of those teeth, so it kind of looked like he didn't have any teeth there when he was smiling. So yeah, we're pretty happy with that now. Good. All right. Get into the top now. I'll get another one of those. Thanks. So I've got my guide here. All right.
So the small piece of equipment Dr. Murray's got there is a probe that has various measurements on it. They might be 1 millimeter, 2 millimeter, 3 millimeter, and he's measuring how much of the gum to actually remove, and then just marking the gum with a little point. So we can see, yeah, it just has a visual aid when working with that scalpel around the edge of the margin there, so it just knows exactly how much to be removing. Very precise profession, dentistry. More so than most people realise.
Let's get a. Can we get a Optrigate, please?
Yeah, often dealing in measurements. So in the mouth, you'll often be dealing in measurements of 1/4 to 1/2 millimetre. Adding, subtracting 1/4 millimetre here, 1/4 millimetre there can make just such a profound difference to the aesthetics and confidence of the patient over time.
Is that okay if I put some pawpaw on that for you, mate?
Okay.
Mate, only the best service.
Oh, there's no pain.
So right now, Murray's putting in what's called a dental dam, and that just keeps the lips up out of the way. Like, of course, over a longer procedure, holding the lip back can tie the fingers. So with Michael's teeth, you can see the front 6 teeth starting from the middle. You've got the central incisors. The next ones out are called the lateral incisors. And then the big teeth on the corner are called the canines. Behind that you've got the premolars. Or as the Americans call them, the bicuspids. And then the molars at the back. So part of what Dr. Murray is fixing up today is the fact that only the front 6 teeth have veneers at this point. That just means there's a bit of a colour change out on the sides of the smile. And hopefully once all of the front 6 plus the 2 premolars behind on each side are done, you get a really nice uniform broad smile. I think what Michael's looking for. Really precisely following that line with the scalpel. Incredibly steady hand. Once it's got that extra millimetre of length, just peel away the excess gingiva there. Looks pretty bloody at this point, but you'll find these heal really, really nicely over time.
You can actually see the margin of the veneers is only just above here, so we're going to actually make sure that the emergence of the new veneers, if you get the triplex in case we need it, the emergence, yep, just water only, yeah, thank you. Cool, can I get the other one? Yep, thanks.
So what Dr. Murray's doing there is adding actually, yeah, adding
Just
symmetry to the profile of the gum over the top of the tooth. So at the moment there's the arch, you might say, the arch of the tooth, the way
Yeah,
the
the
gum
zenith.
loops over the top is not as symmetrical as it could be. So Murray's sort of restoring that, and then that symmetrical appearance will be further enhanced by the veneer later on. But already you're seeing a more natural style arch.
And because we're already doing the veneers, we can actually touch this up by hand with a dental drill as well. We don't have to be concerned about the ceramic. So even though we did all of the measurements, we just want to make sure that we have the right symmetry from the centrals, and then we can work out side to side from there.
Yeah, interesting point Dr. Murray's made with the start. All things in dentistry begin at the midline,
Thanks.
building that symmetry out, 2 teeth at a time, and the information one tooth gives you the ability to flow on to the next one with confidence, knowing what you're aiming for. Dr. Murray will move on to the lateral incisor, applying firm pressure and then sweeping that blade around to create that nice arc, a bit like a McDonald's arc.
It's a red arch, not a golden arch. Isn't that right, Dave?
That's right. Beautiful to watch.
Blade. Thank you.
Just to trim that, any little excess gingival back. I was just running the high-speed drill, so that's what the dentists call a high-speed. Amazing piece of equipment. It's sort of spinning at something like 2,500 revolutions per second. A drill like that actually could allows you to cut through something as hard as soft steel, like butter.
You can see the difference there between a brand new scalpel blade. It's just so much more efficient at trimming the tissue.
So yeah, every couple of rounds, every couple of teeth. Murray's assistant Alice is working furiously in the background to help Dr. Murray do this. She'll change that scalpel blade over so it's nice and sharp. They get blunt very, very quickly. And that's mainly because whilst they're cutting the skin, they're also touching against the bone underneath, and that bluntens them pretty quickly.
Get another one there. Yeah, it's just the tip of the scalpel blade is very, very, very fast to blunten against the root or the ceramic or the tooth or even the bone. In these areas we don't have any bone. There's actually, from the original gingival height, between 4 to 5 millimeters. Basically, if you were to look at Michael's skeleton underneath the teeth, it starts sort of around this area down here, his actual bone. Then we've got a healthy amount of gum. So we actually had a little bit of excess, which is not altogether uncommon, but it does happen. What we do in other cases where we actually have the bone higher is we cut the gingivectomy, and then what we do is another procedure called crown lengthening, where we actually we flap the gum away, and then we actually take the bone away, and then we resuture it back. And that just means that the gum height is ultimately much more stable.
Yeah, so what Dr. Murray's talking about there is that sometimes, so you can see Michael, Dr. Murray's able to just cut away the bit of excess gum and restore the symmetry of each tooth, but sometimes the actual bone, jawbone, that holds the teeth in place is in the way. And so it's a more advanced procedure, but kind of quite incredibly, the dentists can numb up the area. They can actually peel that gum skin all the way back, exposing the bone, and have it still remain alive. They can remove some of the bone around the teeth, and then they can stitch that gum back over like almost, you know, putting a quilt back on a bed. And that enables, and over time that bone reheals, the teeth have a different visual profile again, and yeah, they can do some absolutely incredible things with the jaw. So there's some really extreme surgical procedures that can be done where they, I observed one once where they actually removed, almost disconnected the entire top jawbone from the skull, brought it forward, and then screwed it back on as well. So this, yeah, the surgical ability of maxillofacial surgeons and general dentists like Murray is pretty remarkable, incredibly precise.
This will be the last one. Nearly done with the cutting, Michael. There we go. You can even just see now the length difference in the teeth. He's going to have a look for himself with his bone. Can you see the difference? Oh, you can't because of the light. Can you see? Good, hey? So I'm going to build the profile of the veneers. I'm just going to probably, when I'm prepping this one, actually I might do it just now. I just want to take a bit more from here. No, I'm happy with that. Just check. Check, 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 check. Lots of checking. Great. Let's get into it.
None enough?
It looks a bit blown out still, but I'll leave that up to you, Charles. Yeah, you'll be numb enough. Yeah. Yes. Yeah. Yeah, mix those two for
So
me.
the next phase of the treatment Dr. Murray is going to undertake is actually to take a
It's just an insurance impression. So
Yeah.
we're taking an impression to register where the teeth are. So where are the teeth at the moment? So if we have a power failure and we can't make the veneers today, which has never happened yet, touch wood, there's some wood over there, it's going to mean that we can still give Michael back some teeth today. You got the tray? Got the tray there?
So this impression will
Tray?
capture
Impression tray.
the shape of the original teeth before they've been reduced
Medium.
in size.
Thank you.
And that means that at the end of the procedure, if Murray needed to put temporarily send Michael home before the veneers were made, he could actually use
Suction hours.
that impression, that
Just keep the
the
blood
shape
off
of
the
the
teeth.
original teeth to turn into to then fill with a gel, a little bit like the gel you're seeing now, and actually but it would be white, and it would basically recreate the shape of his teeth, even though they've been reduced in size somewhat, while the other ones are made. So Murray's put
Staying open.
a really like a light body green gel on the teeth, and now he'll put the heavy body over the top, and those two liquids will stick to each other, and then they'll harden over the next few minutes.
And it's really important to make sure that as much as possible there's force is being applied to where the gum meets the tooth, because that's the area, and when I'm saying force, I'm saying force of the material that's being injected, because that displaces any blood in this case, because we're doing the gingivectomy same time, or saliva. The other thing that I do is I like to have a more rigid this purple material, because it continues to push more into towards the gum, because that leads to a higher level of definition. Now we probably won't even need to use this, it's highly unlikely we'll need to use this impression, but if we did, we just want it to be as accurate as possible for Michael. There's other ways of doing this. You can get a lab mock-up done as well, but one of the limitations of that is that the gingivectomy is something that's done chairside with precision, so when we crafted the gums just then, and so it's not possible to get temporaries all the time in advance that have the fit to those new gums that we've just created. So we want to be able to do that as accurately as possible, and so sometimes having a lab at the practice is very helpful like that, for which we are very grateful at this practice, aren't we?
So you can see that material's getting harder and harder now. Dr. Murray's just waiting for the right moment to pop it out. So Dr. Murray, you're saying at many clinics they would use this impression, prep the teeth.
So this impression would have been taken previously at other, it depends on the procedure,
Yep.
but generally speaking, you probably have an impression before the day of preparing for veneers.
Yep.
We don't need to do that because we can do everything through the scanners, so which is quite fortunate. There's a series of impressions normally that are taken. One day when I have solar batteries at the practice, I mean not solar, but you know what I mean, yeah, battery backup, we probably wouldn't need to take this impression because the technology is so reliable and consistent. But hey, I am aggressively conservative, so I want to have insurance. Very good. Oh, we've stuck it to our Optrogate. That's wonderful. Great, and so we'll just clean this out and then show the camera. You okay? Just close a little, it'll be easier, yeah. Cool, mate. Michael has the most amazing lips, so it's really easy to put this Optrogate on. Like, it's rare to have lips that are that helpful. I'm just gonna clean that out. So I'll just show this, I'll bring this over to the camera. But all of that was done so that we can have, you can sort of see it there. Yeah, there you go. See that green, that little green ring around where the teeth would be, okay? I'll just get a probe to show, but that there is the magic. When you see this area of green here, down the bottom, that's at the margin, and that's the important area to capture. Even for temporary impressions like this, makes it a lot better. Cool, okay.
So right around the neck of the tooth.
Yeah.
Yep, is where you're trying to capture all that information as to how the gum flows. And
all right, so now we're going to get real digital.
Sorry, I think I'm gonna sneeze.
No, you're not allowed.
Okay, no, good now.
All right, so now we're going to go across to the scanner, and I think people can ask questions, can't they? If anyone does,
absolutely.
if anyone would like to.
Let me jump on your Heal Dental Care Facebook page and see if anyone's posted a question.
All right, we're just going to get started with some scanning now. Thank you. So just triplex as well, just to wash off the top jaw if you can. Everything, yeah, just follow it, I'll give you help. Yeah. All right, no, just, yeah, take it. Okay, the most important ones for this are just keeping that tongue in the floor of your mouth, if that's okay. So you've just got to get these back teeth really dry because they act as the reference to integrate the scans later. So this is actually going to be our biocopy upper. We'll copy it as the upper jaw as well. There we go. You'll see me spend a fair amount of time, strangely enough, capturing the data on the back teeth, and then we won't worry a whole lot about the front teeth, the top front teeth to begin with. And the reason for that is we're going to rescan all of that information at a very high level later. After the old veneers have been removed. Close halfway, Michael. Is that a bit more comfortable? Yeah, just close a little bit more if you need to. Because sometimes we get these patients like yourself that are just ultimately way too helpful and they hurt themselves in the process.
So this bit of technology is a digital scanner, and it's taking somewhere in the order of 2,000 photographs per second of the physical material in front of it, which is the teeth, and stitches all those images together.
Something in your gum?
Into a three-dimensional model.
Oh yeah, there.
In colour.
Is that better? Was that what it was?
I think, yeah.
You think so?
All right.
Yeah, there is something like up here that's pushing up.
Yeah, I can feel that.
Is that better?
Yeah.
Okay, see how that goes.
Yeah.
Feels weird?
Yeah. Oh, annoying.
Bite together for me. So importantly for this scan, what we're capturing is the bite position, and we actually don't want to capture too much of the top teeth, because in the next section we're actually going to cut those top teeth away. So we want to capture the back teeth on the top and bottom all the way to the back where we had previously scanned all of that really accurate data, and that really helps us. Sorry mate, you okay? So you'll see there that we've actually captured all of that data really accurately in the areas where we're going to keep the same model. And this will allow all of the models to articulate. So if we copy this here, we'll see that it gets a green tick next to it. and that means that they're joined up. And then when we look here,
Cool.
it is pretty cool. Just close for me again.
I can feel it
here's-
going on down there.
Yeah, yeah. Suction. Right. Just gonna make sure I've got that as accurate as I can.
So this
Staying
angle-
close together all the way, no opening.
So now Dr. Murray's scanning how the teeth bite together. So not only a model of the top teeth, but then also how they bite down, so that any new veneer or process that's created doesn't interfere with that bite. There's nothing worse than a grain of sand between your teeth, and that's how accurate this process has to be, so that there's nothing extra left over once the new veneers are completed. Michael's obviously got some older veneers on at this point that are going to be
Opening for us.
removed
Oh,
fairly
half that
shortly.
way. Yeah. Opening wide. That's nice. I can check the fillings that the associates did on you.
Mm-hmm.
We can get the video feed and check back on it later. Probably a lot of people down south that are able to sit online and watch this sort of thing at the moment, because everything's still locked down. Feel for those guys. Cool, so what we're going to do now is I'm actually going to cut out the facial surface of all of the teeth that I'm going to be preparing.
We've got a few questions coming in, Mark, actually.
Yeah, great.
So, JP Pearson asks, can this detect if people grind their teeth?
The scanner?
The scan. Can
Yeah.
the scan detect if people
Absolutely.
can grind their teeth?
Yeah, that's a really good question. It can, because you can see a wear facet, and it's actually used in more than just detecting things like grinding. It's actually used for dental monitoring of decay as well in a large part, because what is happening is that yeah, thanks. I just want the vision of the computer. Cheers. What is happening is that over time we get an idea of, when we scanned at this point, how was the person's tooth when we scanned 5 years later, and so it absolutely.
You can kind of get a before and after.
Yeah, and during as well, which is sometimes actually even more helpful, just depending on the patient's situation, of course.
Well, that's cool. And
But for patients that are undergoing like aligners, or patients that are undergoing like braces, monitoring is actually really, really important. And so it's actually used for that as well.
And another question, someone said they'd love to get one of these scans done. Can anyone get one of these scans? Is it only with certain procedures you get a scan, or?
So these scans, they're just like a dental impression, but it's a digital version. So, you know, if you had a need for them, then I'm sure that your dentist would be able to arrange them for you. You know, my opinion is that they're actually really, really helpful instead of impressions, but there's no need. You got to think about why you're getting them. So anytime that you would need a traditional impression from a dentist, so that's when they would normally put gunk in your mouth, then this is absolutely the thing that you can get.
Like you could, when you're getting a mouth guard made, for example, everyone's had an impression.
There's no need anymore. Yeah.
You know, you can just basically have a
scan
digital
now. Yeah.
a digital scan instead of a mouthful
Yeah.
of blue goop.
So you can use 3D printers within the practice to basically create stone, what would previously be a stone model from an impression. But sometimes just for speed, we will take an impression in the practice and pour it up. But it's actually minimised the amount of waste substantially that we've, you know, we used to have a lot more waste in the practice before.
Yeah. And so what are you doing at the moment? It looks
So I'm
like
just clearing up the model and getting rid of any excess data so that I know that I've got a model that can register ideally. Now, it's not the end of the world if it can't. There's a few things that I can do to clear up the models later if that's
When you
necessary.
say clear up, what are you eliminating there?
Just about the additional data sets that happen during the scanning. So
like
aberrant
those
data. There's these little bits here are not, you know, helpful with when we're trying to register things, so we can get rid of those.
Oh, yep. So you're deleting where it's caught the lip or...
Yeah, that's exactly right. Yeah.
So you really, because you don't really need anything other than the teeth. Is that right?
No, we don't need anything other than the teeth. And what we're going to do now is we're actually going to make both of the models the exact same.
Okay.
What I will actually do is I'm going to save myself another version of the biocopy upper as what's called the Gingival mask upper, because I like to have as many sets of data as possible, just in case I need them. But these catalogues are used later in the case. It's a bit more in the design phase.
Okay.
I got a question.
Yeah?
How long did it take you to learn this program?
How long did it take me to learn this program? Actually, we will leave that. Oh, good question. I'm still learning, mate. I'm certainly not a professional. I've had some really great mentors. There's some great people in Australia that have helped me. I'd say 5 or 6 years I've been using this at the moment.
And what's this program called, Murray?
The software is called, or the machine's called Ceric.
Ceric.
Yeah.
Machine, yeah.
Alrighty, let's get into it, hey?
Am I not enough?
Do you feel numb enough?
I could do this alone.
Oh, well, let's get you some more then.
Okay.
If the man needs more, let's give him more.
I feel like I can feel
The thing up the top?
that little
Yeah.
bit of skin.
Yeah. Yeah.
There, and then
Yeah.
also some down the bottom. You know how like sometimes with the nerve you can feel this like this,
Yeah.
like little.
Yeah. I'm going to try and numb this one up a little bit higher for you to try and help that feeling. So I'm just going to do half at the moment, and then we'll do the other half when we get there. Okay, opening up there for me, mate. Just making sure I've got the shapes here because I'm actually using those as a reference.
So I think it's time for the veneers to come off.
Yeah, so we're going to start at these back teeth. We are largely just adding Not wider for me there, Michael. Thanks, mate.
Murray's just using the full surface of that spinning drill blade just to smoothly trim back the cheek side of the tooth. They call that the buckle. So the buckle or the cheek side of the tooth. Crazy amount of skill required to just really precisely and gently remove about 1 millimetre 1 to 2 millimetres off the outside of the tooth. A good way to think about this, doing this would be with the people at home. It's a bit like, probably a bit like almost trying to peel a potato, but only 1 millimetre off the full surface of the potato. You can't damage it, and you can't touch anything next to it. You've got to be utterly and completely precise with the drill. Very unforgiving. A lot of people don't know, but yeah, dental surgery, because the teeth don't grow back, it actually requires more precision than medical surgery, where things often do grow back. But teeth do not grow back, so you cannot have a slip of the wrist. It's got to be, there's 0 mistakes in dentistry.
Just on these top areas here, I'm just doing a little bit of roughening. I'm not actually really drilling these areas here and here. I'm creating a margin down the bottom because Michael actually wants us to build out this area of the tooth. So there's no reason to do that.
Yeah, so Dr. Murray would be creating a sort of a 3-dimensional model of the future teeth in his mind, looking at, okay, if the end result has to be a tooth of this size, what sort of surface do we need to be able to stick
Staying
to?
at the wide.
And he's preparing that surface so that when it comes to sticking the eventual veneer on, the surface is the right shape to grip on, the right, and also there's enough size so that the material that's stuck on can be thick enough to not fracture or break in the day-to-day stresses of, you know, Michael chewing and eating, etc., etc. So extremely gentle, even though you are doing something that seems rough.
Oh yeah. Do you want some now?
A little bit, yeah.
Is that better?
We can do not.
How's that, mate? Is that okay? Now we're just going to see with this veneer here, just open for me, how deep it is, because we don't actually know how deeply they've been made. So I'm using a different burr. And they're quite deep. But fortunately, the material is not, it's not overly coarse. Now occasionally we can fracture these off, but not in this case.
So Dr. Murray's drilled what's called a guide there. He's sort of done a groove in the tooth to find out the approximate depth of the remaining tooth underneath the veneer. And sometimes it's enough to just put a little lever in that groove, and the two parts will sort of click apart and come off. But not in this case. So Dr. Murray's doing it the old-fashioned way of grinding away that porcelain veneer bit by bit. He'll know that the porcelain veneer has finished and the tooth has started by a very subtle change in the colour that you probably won't even be able to see through the camera. But he'll know when he's getting close, it'll get lighter, and then he'll know once he's through down to the enamel, remaining enamel, or it's probably deeper. It's probably the middle layer of the tooth it's bonded to. So, and that's called the dentine. Dr. Murray's just removing the edge of the porcelain veneer. Almost like colouring in at this point. It's the most similar skill that you describe it as. You just, just like a pencil, gently brushing it against the tooth until you see the colour change in the right place, just like you did back when in primary school, but obviously a lot more serious and high stakes. Porcelain's a very hard material. It's actually harder than teeth. Turning it back right on along the gum line there, you can see the tooth has changed relative colour now. Amazing footage. Here at Heal Dental Care, which has got the full audio-visual setup. One of the few in Australia to have such an ability to bring patients into the treatment. So, grateful to be here.
So now you can see if we dry it off, we can see that we're just through. So this is natural tooth here, and this is it's still an adhesive. So there's been a very aggressive preparation previously for the veneers. Would that be about right, Michael, from what you've experienced? So I've just, for the first one, I've got to be really careful because I don't know how aggressive the previous work is, but I'm just making sure that we leave as much natural tooth.
So you're saying that veneers that got done had a fair bit of tooth was removed to enable those veneers to be stuck on. And that's not altogether a bad thing. Because sometimes when not enough tooth is removed and the veneers are bonded on, the teeth can carry sort of have an appearance of being slightly too big for the mouth, which is obviously not what the patient's looking for either. So there's a real sweet spot. Too much removed is not great for the teeth, but too little and the appearance will be a bit big. So it's a really delicate judgment as to how much tooth is is removed and how much is retained.
You're gonna need that one because of the extent.
Yeah, I know when they had done it all, I was like, oh, that's intense.
Yeah.
Like when they had prepared it and
Yeah.
just like no veneers on it.
Yeah.
So given the hardness of and the size of these veneers that Dr. Murray's removing, he's grabbed a bit of a bigger burr, so it's got a bit of a bigger shank, a bigger circumference on the actual burr of the drill, but also it's got a coarser diamond on the outside. So because that's rougher, it will cut through that really hard porcelain easier, and because it's easier, because it's easier, Dr. Murray will be able to be more accurate because he's not having to sort of push as hard, so he can be more sort of dexterous and skillful with the removal of something that cuts through pretty easily. There's just so many different micro skills that go into becoming a good dentist. Trying to understand, you've got to understand the equipment, you've got to understand touch, feel, a lot of visualization in three-dimensional space. There's a lot more to it than there seems. Any questions on veneers, guys? Just shoot them through and we can ask Dr. Murray at an opportune time.
I asked Dave to come in today because he's actually a dentist himself.
Yes, that's
and
right.
I tend to get in the zone.
Yes, I was talking to Dr. Murray and he said he was doing a live surgery. And I thought, I know how difficult it can be to concentrate while trying to keep everyone informed, so I thought I'd keep him informed today, talk everyone through what Dr. Murray's up to, so he can focus on the job at hand. Moving on to the central incisor, Dr. Murray will cut another guide in the middle there. It's looking for that colour change at the appropriate depth. Dry it off. That'll also be a bit of a tell. When it's dry, the light shines through it differently. We can see where he's at. Obviously then run the drill latch sideways out from that point. Go from there. up the anaesthetic there. The anaesthetic goes into that soft tissue of the lip up the top. Fills up, almost fills up that lip like a balloon, and then soaks in to the upper jaw. The upper jaw is a bit different to the lower jaw. The upper jaw is sort of full of, is almost like a sponge in terms of its structure. It's got a lot of different holes in it, so it tends to absorb the anaesthetic really quickly. The lower jaw is a bit different. It's rock hard. Needs to be able to bite on things, crack them open. And so it's got a harder outer surface, so you need to sort of cut it off at the pass, the nerve so to speak, and you need to inject it a bit higher up in the back of the mouth, and that then knocks out the whole branch of the lower jaw. But the upper jaw we can be a bit more accurate.
So Michael had gaps between his front teeth before veneers, and so he used to have like a diastema.
Right.
Yeah, gap. Yeah. There you go. I thought that they might have drilled through beforehand, but it's such a large gap that I wasn't sure. So there was always a gap between Michael's teeth. So we're going to see that gap because we're taking off the veneers.
Yeah, how long? Yeah, so we'll save that question for, where'd that come through? Oh, yeah.
Depends how well they're looked after. Veneers, how long do they last? So Michael's done a pretty good job of looking after these ones.
So we've got a heap of questions coming through actually. So what are veneers made of?
So we use a glass reinforced lithium disilicate, generally speaking. It's a glass. It's a very, very, very strong porcelain. We manufacture it in-house with our own machinery and our own lab. Most dentists would make veneers by outsourcing the work to someone else, normally a technician who would make them.
Yep.
And that's fine. We just have taken all of that work on ourselves, just because we can then get it done faster for the patient. And a lot of the labs now use the same technology that we're using in the practices to deliver those treatment outcomes to their patients. So we're just doing that ourselves. And but yeah, glass. So glass porcelain is generally the material now. You can also have plastic or resin veneers, and you can also have very skilled dentists that do like really high quality resin veneers that are colour matched and shaded. There's an excellent specialist on the north side of in Brisbane called Tony Rotondo, and he does some of the best resin additions that I think I've ever seen. And it's a very conservative, painstaking process, but you know, some dentists just have incredible skills at that. One of the downsides of the resins are that they can stain and wear a bit more than ceramic over time, but then ceramic veneers, they can also debond. They can also have their own myriad of issues. So there's nothing as perfect as natural tooth structure, but you know, Michael, when he started out, he had a diastema, and he had some other, you can see here that this tooth was a bit crowded as well. It was sort of turned a bit forward based on how it's presenting in the mouth. I can tell that now from looking at the teeth. In fact, both of them were turned in a little bit. You can see that, and so you know, you can't. if he's got teeth like that, he's going to want to make a change, and for one reason or another, veneers was the option. Excellent. So sorry about that, guys. We're back. We're back. I wonder if it got jumpy towards the end there. It probably did. Yeah, just a little bit. All right. I'll give you a little bit of a jab just down here to try and make that a bit less sore. Open wide. So yeah, Michael's last veneers, they lasted for, 10 years. I do hope it's not the foot pedal. Do we have batteries for that? Do we have batteries for the foot pedal if we need to replace them? Would you be able to go check with Diana? Thanks. So you can see, I'm not sure if you can see through the mirror, but there's still a little bit more ceramic on pretty much each of these teeth to take off. It's a bit hard to see with the mirror, but it's probably like a 0.5 millimeter or so. Okay, well, can you please get her to call PDS and see if they can maybe drop one off, or because we just, I think that's the issue. It's got the exclamation mark. Yeah, sure. So we're nearly done with the drilling, which is good.
We'll have to take a photo without anything.
Sorry?
We'll have to take a photo.
Yeah.
Like,
Well, we got stills that we can get from these.
yeah.
You can get one as well.
Yeah.
You'll have lots of time when we're not in your mouth. All right. Open wide for me, Michael. Sorry, man. I know it's uncomfortable. Maybe put your head to the right. It'll be a bit easier as well. Sometimes that's a lot better.
So this is Michael's last veneer that Murray's removing. Prepping the surface off.
Still see that frostiness here, which means that we've still got lots of ceramic there. So
Still got a bit to remove yet. So it's a bit of a full body coordination activity. The speed of that drill is determined by the pressure Murray applies to his foot pedal. So it's sort of a bit like playing drums. You've got to time the bass pedal with everything else. So same with applying, just the the pressure on your foot to make sure that drill is spinning adequately. If there's not enough pressure, the actual drill bit will stop. If you send it too fast, then it'll cut too quickly through the tooth. So you've got to just be constantly sailing, sort of balancing the pressure on your foot, through his hands, through his fingertips, and on the speed of the drill. So not easy to do. That's why it takes dentists 5 years to train. Most of that spent hands-on. The theory you learn pretty quickly, but it's the practice that it takes a long time to master.
Fair way back. And so still does need a bit more reduction. You can just see there, that's the edge of the ceramic just coming off. Really need that just to be over the top there. Yeah, thanks. Just wherever the spray is most. Yeah. Thank you.
So we had the question come through: is the veneer stronger than your natural teeth? And I think the answer to that, I'll check with Dr. Murray, but I believe the answer is yes.
Well, it's a really good question because the thing is they're different structures. Yep. So glass ceramic is like a monolithic crystal glass, right? So it's hardened in a furnace, yeah? And so it doesn't baked. Have any ability, like the ceramic doesn't have the ability to like deflex the same way as natural tooth structure.
Yeah.
So while on one hand, technically yes, ceramic is stronger, it doesn't have that yeah, like you said, like that ability to deflex. So good question.
Yeah, that's sort of probably what makes teeth a bit special, isn't it? Is that they're so hard, but yet they're
so hard.
They can heal themselves, and yeah. So long story short, they're by design. They're, I think what you're saying, Murray, is they're similar hardness, but they have different characteristics.
Yeah, so I'd say like objectively they are stronger, but it's not just about strength. There's all these other factors that come into play.
Determine whether they succeed or not.
Yeah.
You actually wouldn't want something clearly harder than your teeth because
you've got to get a material that's strong, that's got the aesthetics, that bonds. You know what I mean? There's all these factors that go into the
choice.
These companies, open wide, the companies that make these materials, they really spend a lot of time getting those, the balance of those things right. It's a big industry. Anyone knows how to make a better dental material replacement, more natural, more aesthetic, more flexible, still bonds into the mouth, all of those things.
Please post the formula online now.
Do some more checking. You'll see I keep going back and drying. I know normally it doesn't actually, I have underestimated the time this takes, but that's okay. You can see there's a bit more ceramic here. I didn't know they were quite this thick. It's alright. There's still, yeah, Alice is like, there's still more. I find myself very blessed to be around nurses that are that connected to the procedure that they know the same thing that I'm thinking.
We've got another question come through. How
I'm amazed people are watching.
Yeah, we've got a few people watching. It's good. How long do the veneers take to make, and how do you make them? Well, I think that'll be pretty well covered.
Yeah.
In the video.
Yeah. So we're technically already in the process of making the veneers. If you want to be really honest, because we've got to get where they sit on the teeth right. So that's the process that we're going through at the moment. And then you'll see the rest as it comes. But normally it's a two to like a 2-week turnaround. Some clinics have developed the speed of their manufacturing so that they'll do it like the next day. We're going to get these done today for Michael. There's still more on that canine. Still more on there. You've got to go back. There. Okay, so now I'm going to see if there's any major bits of ceramic left. There's a couple. here. It's got a lot still. Not a lot, it's just a bit on the side. And we're nearly there. So we wouldn't want to have the old veneers still there, because that might mean that we have debonding. So we're just trying our best to now we're going to switch to a different dental burr. This one's, you good? Oh yeah. This one's quite fine, and we will just be refining all the preparations now. So head to the, open a little wider, just for these back ones, yeah. Thanks, mate. This is not good. What did she say? Okay, because I might need it, right. Staying open, Michael. Yeah.
A lot of things in dentistry you do sort of layer by layer. So Murray's done the first sweep, getting all the bulk of the porcelain off the teeth. And then once you've gotten the bulk of the material free of the teeth, you then come through with a bit of a finer drill. And you're starting to really neaten up the surface preparation to be exactly the shape that you're looking for as you do this. So you see, really paying attention to sort of the defined tip of the drill towards the bottom of the teeth. There's a really tiny little step that's being cut into the teeth so that the porcelain veneer has something hard to butt up against, and then it's eventually glued on or bonded on. Many things in dentistry you have to be patient with, just bit by bit, gliding. Nothing can be rushed. Just prepping that lateral incisor now, just getting it ready for the veneer.
down slightly. Thanks, mate. You can really see the difference now between the tooth structure and ceramic. You okay, mate?
Mm-hmm.
Okay. You'll see the tooth structure looks much smoother after this burr has gone over it. We actually want to roughen the tooth structure a little bit later, but instead of using a burr, we use a special sandblaster. The reason that we want to roughen the tooth structure later is that we'd really like to ideally, we'd like to just get ourselves in a situation where the tooth is ready to what's called cohesively bond. So if its structure is roughened, it's more receptive to the bonding agent. So microscopically, although we want a smooth preparation so that the veneer fits well, we also want a certain level of roughness on the textured surface of the tooth, and that will be advantageous for the longevity of the bond. Does that make sense?
Yeah, so
Longevity is probably too technical a word, but how long they last. It's hard, it's funny, I get into my dentist mind when I'm drilling teeth. That's why you're here, Dave, helping me out. How are we going, Charlie? Are we still dropping frames?
It's on and off, but it's mostly smooth.
Mostly on?
Mostly smooth.
Mostly on, mostly not off?
more on than off. So yeah, so what Dr. Murray's saying there is that, you know, it looks like, to the naked eye, it looks like he's smoothing the surface of the tooth with the drill, but under the microscope, it'd actually be roughening that surface so that when you
It's probably a little bit smoother now than it was before, but the next step when we go to bonding, it'll get that roughness.
really rough, yeah.
Yeah, that real roughness back again.
And that's going to allow the teeth to
To the right.
almost like the glue. If you were going to glue something, if it had a rough surface and you put the glue through it, it sort of binds to all the rough outcrops in that rough surface.
Yeah,
It's the
exactly.
same with veneer. So you'll have a rough surface not only on the exterior of the tooth, but as you'll see later, the inside of the veneer is also got a rough surface. And that way the binding agent sort of grabs the two sides and holds them together over the long term, which is exactly what we want. So when Michael's on the red carpet, he's looking $1 million without any concern about it.
Yeah, we don't want them to come out on the red carpet. basically the first directive that Michael gave us when we sat down. Said, "Now, boys, the most important thing."
Anything but that.
Actually, been a real joy to work with Michael on this. He's a busy man, so it's taken some time for us to line up our schedules. Okay, just staying open nice and wide for this last one. All right. Great. Now, because of the degree to which we remove those prior veneers, we don't need to do too many checks. Normally, we have what's called a putty key that we would use to do some checks. But in this instance, because we had veneers there previously, we know we can replace that structure. So, a lot of the time in this procedure, in particular, is spent, so I'll get the astringent, is spent just making sure that those veneers were removed properly, and I'm quite happy with that now. I'm relatively happy with the margins that we've achieved on the teeth. Let's see this one. I'm going to assist myself. Open one. Great. Okay, back in the middle for me. Just getting you to dance around, that's all. Okay, now I'm just checking again to see that our gingival heights look nice and even, and they do. We can use a straight instrument to do that. That just allows if you put your chin down, the camera will see it a little bit better, although not a whole lot better, but just to make sure that we've got a nice degree of symmetry there. Cool, happy there. All right, let's get that astringent. So now what we're going to do is just make sure we cut off some of that bleeding around the gums. So just do a first run through with just it's like a liquid that stops bleeding, that doesn't affect the procedure in terms of the bonding strength or the colour of the veneers. It's important that you use the right quantity of materials as a dentist, because some of them actually, unfortunately, do affect the long-term colour of the veneers. So you've got to get the right one.
So that's almost like a clotting agent or something, Murray? That's how everyone would describe it?
Such a wordsmith, Dave. Honestly.
It's like...
I get all technical and he's just very helpful. Thanks, mate.
Oh, that's how I got through dental school, mate.
Yeah.
Dumbing it down.
No, it's very important. I often tell people about the story one time where I was talking to a patient in the dental chair, and I was getting very technical about my description of how a crown worked. And I just realised I was talking to myself. And from then on, I did try to consult differently. But, yeah, it's one thing to have, all of that background, and then to communicate, it's just a whole nother thing. But yeah, it is a clotting agent. You can see the difference here. That was all leaking red before, and now it's pretty much stopped.
Yeah.
I didn't want to put it on twice because I don't want to. So I didn't put it on before. There was still bleeding during the procedure.
Yeah.
Because I was still going to be drilling around the gums, and there was a very good chance that it would mean that there would have to be more bleeding. So you don't want to be stopping and starting and stopping and starting, doing different things. You want to try and do the same thing completed and then move on to the next thing. So now what we're going to do is we're going to lay a cord please, a very fine cord around all of the teeth. Now this cord, I'll just show you there on my glove, it's like a little worm, and the gum is the garden, and when we take the worm out, there's a hole afterwards that allows us to see where the worm has been, and that's important because what we want to do is separate the tooth from the gum, because if the tooth and the gum aren't separated, right, we're going to have a real hard time knowing where to make this veneer to. So this is the technical process that a dentist goes through to do that. It is very important, but it's also quite time consuming, and you might find it a little bit boring. So feel free to go make yourself a coffee. I'm still going to be here after your coffee is done. Good time to answer some questions, because this is quite...
Yeah, so...
Right, so these are just a little bit long. If you can just cut the next one to be a bit shorter. I'll get one first. Thank you.
So how long does this cord stay in, Murray?
This cord stays in until I'm ready for the next stage, which is scanning. So it's quite amazing. I put this cord in and then I take it out quite promptly. And the reason for that is that it's not used in the mouth longer term. It's just purely so that we can access very confidently where does the tooth end and where does the gum start. Now there's other techniques. Other people use creams. There's something called Expasil. There's other products that sort of try to achieve the same thing. But for my workflow, for consistency, this is what I tend to use. There's a lot of dentists that use the technology that I'm using that wouldn't use this, but
it just clears it all out of the way.
I'm just a creature of habit, like
gives you a really good view of the tooth almost.
Yeah,
when you scan it.
I'll probably put this one back in. This line where the tooth ends, where the drill has cut it away, that has a technical name in dentistry. It's called the margin, and it's very important to keep that clean, to keep that healthy, to keep that well brushed and looked after. That's a bit longer. That's good. So I'll that's a good size, Alice. Now the thing about these cords is we want them to be in, but we don't want them to be so deep that they disappear. Because if they disappear, they don't really perform their job of separating the gum because they're down too deep. So it's a bit of a dark art. Some techniques out there say you put in 2. I don't tend to be a fan of that because I find it compresses the tissue too much. I don't want to cause damage to the gum long term. So my opinion is that if I place the right size cord with the right amount of pressure, and that'll be just right. Another one? What was your approach, Dave? Were you a cord dentist back in your heyday?
I didn't mind a bit of
long
cord.
Okay, that should be enough short ones for now.
Didn't do as many veneers as you.
For crowns and that
wasn't
sort of
quite,
thing?
Yeah, I did mainly whole crowns, single crowns. Didn't do too many big cases.
Did you do very many?
I did one.
But I mean, like, did
Yeah.
you do much? Do you use cord for crowns and that sort of thing? Or?
Yeah, oh yeah.
Yeah.
And I tended to put in. I'd put in a tiny cord,
Yeah.
like tiniest one I could, and then I'd put in almost the biggest one I could.
Yeah.
like
So like a double cord technique.
size 2, I think, from memory.
Yeah,
and
great. So I sort of use like slightly bigger than the smallest. That's my approach. Yeah. There you go. Look at us reminiscing about dentistry. Can I just get the micro scissors or some sort of? I'll just have to cut these. They're just, his teeth are very different sizes. Nothing wrong with that.
So I always I didn't have the digital scanning tech, so I'd take a normal impression, and it'd always be a bit of a victory when you'd take the impression out and the cord was
Oh yeah, you
like
came out with it.
pointing at you.
Yeah.
Going, good.
Oh, I remember taking impressions like that. Man, yeah, that's.
Back in the
I do remember that.
80s. Well, not quite, but.
So after this, Dave, all your dentists are going to be asking for scanners.
Well, they've got them.
They've got them.
Yeah.
You got a couple of scanners.
Yeah, we've got scanners, mate.
Oh, great.
We got a scanner at each of the clinics. So.
No, they.
But not a mill. So we don't mill.
Right.
So
yeah,
we
in-house.
don't mill the materials like you guys do in-house.
Yeah.
So the idea of doing it all in one day is unique to you guys.
It does take a lot more time from the dentist, I think. Is that sore now?
No, I saw it. So.
Oh, the stuff tastes bad. Hoping we get suction there. Yeah.
It must be, yeah.
It turns out that I actually grew up in the area that Dave has his dental practice. And we both live in the same city, didn't know each other.
So we grew up in the same area. We went to the same dental school.
Didn't even meet at dental school one
Didn't
time.
even. No, it didn't mate.
Not even once. He used to run all the kegger parties. Very, very socially successful dentist.
I ran the rowing club. That was my claim to fame at uni. Enjoyed it.
From what I hear, everyone else enjoyed it too. So quite successful.
Yeah, they did. Once you run a keg party, running a dental clinic's easy.
The kegger parties are the challenge, are they, mate? Getting people to pay for their kegger.
It was $10 all you could drink. It was pretty good deal.
Goodness gracious. I think we need to bring that back. Got a couple of staff members that'll be. They
Right.
sign up for the first one.
Right into it.
Mike will be in for that. Do you drink, Mike? No, he doesn't drink.
I don't drink now either, so you're not alone.
I don't know how to not drink. Get another one, please. Please teach. I'm really liking that length that we're sort of establishing now. I think that's much better. Whenever you get the width and the height of the tooth starting to look similar, the teeth start to look quite boxy. So even if you have, you can have veneers done, and if the proportion of your tooth doesn't change, it doesn't matter. And that's where I find, I really like to spend time planning the case, getting records in advance, finding out, all those little things.
So what has happened before today, Murray?
We had a couple of consults, because you don't really want to probably get veneers with a dentist you don't know. So Mike came in, we had a consult. He sort of told me about himself and his goals and the concerns that he had with his smile. We took some photos. He didn't like the photos and he didn't come back to see me for a while. And then it's because I did a plan, and we actually do that simulation for pretty much all of our patients that would be interested in veneers. We do a simulation. So we take these photos and then we put them into a computer, and then the dentist will work with the computer to kind of produce, well, what do we think that these teeth are going to look like after the veneers are finished? It's kind of like try before you buy, but, well, really
digitally
committed. Yeah, so we use the computer, we use the digital technology for that as well. And then I think what I did was I got the clinic to call Michael and be like, what's going on, man? Because he made such an impression on me when he was in. Big, bold personality, with me being that little reserved dentist. And yeah, so he's, and I said, we'll take the photos again. And so he came back, and we kind of got some traction, didn't we? Got back on track. But he's also busy. He's probably like actually had a school of makeup to run and all the rest of it. He's also been trying to teach me how to use Instagram. It's not really working, but you know, I've had probably the best teacher. So
yeah, it's a big commitment, isn't it? You know, when I was 7 years old, I went down a water slide and fractured my front tooth.
Oh, you got Tony to fix that, didn't you?
And I had it fixed along the way, and then I just didn't have it fixed for like 10 years, and it was funny. It was, you know, I reckon I've fixed 1,000 people's front teeth, but
yours was still unfixed for the longest time.
but it was funny. I got nervous. I got
That's
nervous
one thing
about
I
having to go in, and I had a new appreciation of the whole the perspective of the whole treatment.
Well, this is the thing for me. Like I don't understand. Like I don't have amazing teeth myself, but you don't see anything really bad when I smile. Teeth are so important, hey. Like.
Yeah, it's been good. I've had my front teeth fixed, and it's been a good change. It's been a positive change. My sister pointed it out straight away.
Did she?
She said you look.
Finally.
She said you look less asymmetrical.
Obviously, she's a symmetry person.
No, she's good.
Beautiful thing about the body is that there is really never any symmetry, but we get close to it. I like to call it harmony. We're looking for harmony. If you can do this online, you'll be able to find a photo of yourself and find some program that will give you a mirror image of half of your face or half of your leg or half of your cat. And if you double it up, it looks scary as, like literally you're like, oh my gosh, I'm looking at an alien. So no person is
It's
perfect.
spot on.
Yeah. You can even go do it to celebrities and they look funny too. Even people that you think are the most beautiful, they often have the least symmetry.
Well, the ratio is everything. I got really into the golden ratio for a while there.
Oh yeah.
With 1:1.618.
Yeah.
And how it appears over and over again. I think it's called phi. And yeah.
Michael's like, I need to start speaking about this because these boys are messing it all up. Telling these non-truths.
Yes, if anybody knows beauty, gosh, we'll have plenty of opportunity to educate us in the break.
Great, so we're done with that cording, finally. Sorry everyone that took a little while. So now what I'm going to do is I'm just going to just dry everything off, and now I'm visually inspecting those margins. I'm going to make ever so slight dry prep refinements if I need to, which I probably don't because I had a fairly good look before. Just making sure the cord, sometimes it pushes out, particularly where we start the process of cording. Because it's been in there the longest. Generally it's looking pretty good. So get the spray. Just mix the spray please. Thank you. What would I do without you, Alice, honestly? You're just amazing. Just amazing. Who would have known we had a big surgery this morning just before this case? Had to do a buccal advancement flap. It was a pretty big one, wasn't it? Oh, yeah. No, we don't just need the forceps. This is a full surgical. So what we're doing now is we're spraying a very fine dust over the surface of all of the teeth. So you see how they're a bit whiter now? And you don't want to apply too much. And you'll see in a second what happens. And the whole reason for cording becomes really visually clear in about 5 seconds. So we're optically creating what Dave was talking about before. We're optically creating a contrast, a heightened contrast, because what are we using? We're using a digital scanner. So we want to enable that digital scanner to have the best quality image that it can. So we're presenting the scanner with the most ideal version of the clinical situation now. Nice contrasted image. So now we go through to the scanner. Did that just drop out? No, good. So this to the scanner. I think that's the mill. Here we go. So trying to get the, there we go, we got it up. So now that that all done, open wide, gonna marry up our scan. So we can see that nicely refined margin there on the teeth. And this is the scan that I probably just take a little bit more time with. I try not to take too much time between when I take the cord out and when I take this scan. And the reason for that is that I don't want fluid from the gum to go into that area. But it is relatively controlled. See, I'm over scanning there onto the molars because those molar teeth, just saying a bit more open, Michael. Thanks, buddy. Those molar teeth were involved before with the pre-scan. So we're getting a bit of double up there, which is really, really good. And you'll notice here, really importantly, that the scans match really nicely. I'm just going to go back and make sure I've got all of the data that I need for this scan. So this is the right-hand side that we're looking at there. I'm just going to make sure that I've got all those blue areas covered. Coming back, just trying to access in there with as much detail as possible. You can see just between these two, there's a little bit there that we missed. There becomes a point of diminishing returns here. So that scan's all collected now. What we're going to do is render that through. Michael's going to have himself a break. We're going to put a desensitizer on all of these teeth and then he can rinse out and have his mouth back. He's going to have some lunch and we might do some questions and I'm going to get to making these teeth. Good fun. How's the stream going? We're not dropping out this time?
No dropouts.
No dropouts. A little jumpy. Sorry about that, everyone.
Audio sounds good.
I promise everyone that I will get a new computer for the next stream. In fact, we had Rusty here, our American friend, the other day. And what did he just gave me a really hard time about my wooden computer. It's pretty much new. I just didn't get the right one. Please in the comments, tell me which computer I need so we can share what we're doing. So if you look closely now, what Alice is doing, she's applying the desensitizer to Michael's teeth, and that just means that in the break he's not going to get too sensitive. On the computer screen, you'll see that we've got the models rendering, and effectively this process just means that they go from a raw data set of image to a model that we can then use to design the veneers on. Very good. I'll help you from this side. Excellent. So we'll sit you up there, my friend. So good. So good. So these models are nearly rendered, and so you'll be able to follow along in the live stream as I design these teeth. So we're just waiting for the models to finish rendering. It's quite a lot of data for the computer to process, so that's why it takes a little bit more time. How you feeling?
Yeah, I feel good.
I feel good.
I feel good. It's funny because like you don't realize that when you're like laying back in the chair, I think you create your own issues, like tensing up a little bit.
Right.
And I think I can feel it in my neck, so
Yeah.
maybe I just need to.
I do that when I'm practicing. I tense my shoulder like in a certain way,
Yeah.
and then I have to get like a massage to kind of undo it.
Yeah.
Yeah.
Oh, it's funny.
Maybe we should book to get our necks adjusted after this.
Yeah. Cool.
That's it. Yeah.
Okay.
So we'll let you come. We'll let you be free.
Freedom.
Freedom.
Cool. How exciting.
You're gonna sing us a song with numb lips?
Seriously.
Seriously.
No, it's funny. Are we still live?
Yeah.
Yeah. Okay, let me tell you guys something. So, I would have been about 18 years old, and I was in a nightclub, and this nasty person was like, "Oh, why aren't you smiling? Why aren't you smiling?" And like taunting me about like not smiling,
Yeah.
knowing full well that like I wasn't confident with my teeth. And
Wow.
like taunting me, and yeah, you should smile, why aren't you smiling? And then yeah, I remember just feeling like so self-conscious in that moment about it. And yeah, I think growing up, like I was always super self-conscious of my teeth, and it's funny because like as you were preparing them, and you're like, oh, you had a gap. I was like, oh my gosh, yeah. I can't
totally
believe it, I forgot.
You forgot,
Like,
yeah.
I forgot that I had a gap because I had just like mentally packed that away. Because it was just like one of those things where I was so insecure about it.
I had a gap in my teeth as well, and Murray fixed them.
Wow.
Yeah.
Yeah. So we didn't do veneers for that. We just I think we just
You
We just
put
fixed it,
something-
hey?
Yeah, you didn't put veneers on, it took like 30 minutes, it was
Yeah.
really quick. It was
Yeah.
great.
Yeah, wow.
Yeah.
Isn't that funny like that? Yeah, you just think like, yeah, something. Yeah, it was honestly something that I was just so self-conscious about, and yeah, you just. Yeah.
Yeah.
Yeah, so it's really funny because, you know, going back then, I would never have felt confident being in front of all these cameras and like being out with my face looking like this. I just would never have done that. But now in my life, like I'm a lot more confident in my own skin. But it's very difficult to talk. It's not easy. There's nothing cute about being a dental patient.
No.
Nothing cute about it. So you just gotta lean into it.
Do you want to see your teeth?
Oh, I'd love to.
Come around. We can throw it on the stream as well.
Cool.
So this is your, well, this is what's, so we've taken off the front veneers, but can you see already the length difference is good. So basically what we do now is I'm going to go through and clarify where does each tooth start and where does it stop. So this is, you know, determining what's called the margin of the tooth. So it can take some time to get this right. And this is the thing that we basically were able to highlight really, really nicely by using that cord and the contrast. Makes it a lot easier.
That's cool.
Yeah, hopefully that does it right. Yeah. Now I think Diana's got a juice for you if you'd like it. You don't have to have it. Are you a juice guy, Michael?
Mm-hmm. Anything to get the taste of that other stuff. Nah, really good.
Yeah, that stuff's not the best.
Yeah, you're right.
And then we're doing this one next. So this is basically we're starting with the premolars, and then we'll move further forward in the mouth to the.
And these spots here where it's like indicated by red and yellow and green, what does that mean? Is that,
so those are
like
contacts.
Is that like
That's the bite.
topography?
Yeah, so it is. So we can take those off and on. That's basically what's called
Cool.
your model. Yeah,
Yeah.
they call that the model contacts. Yeah.
Cool.
Yeah, topography's actually a really good way of looking
Tooth
at it.
topography.
That is your tooth topographies.
Bit of a mouthful when you've got a gap and your mouth is totally numb.
Totally. 100%. This is super nerdy, Michael, so I wouldn't expect you to hang out for this whole thing.
You see what I do with Adobe. I show you.
Oh, it's
Like,
true.
It's all very nerdy stuff.
It's
I'm
very,
into
it's
it.
actually super nerdy, but I love it. It's because it's,
So when I was like coming up with ideas for the new school design,
design, yeah.
I downloaded some architecture programs because I wanted to be a part of the experience. So
I love that.
I got into it. So
You gotta do what you gotta do. Like, creativity just pushes you to just carry on.
oh, there's so much artistry and technical nuance in what you're doing. And I think that that's something that probably isn't appreciated by a lot of individuals who go, oh yeah, you've had veneers. It's like, well no, like it's not just something that you just whack on.
Yeah.
There's so much work that goes into what's happening.
Yeah, I enjoy doing this. Like, it's something that it's really rewarding. We get a lot of patients that have had, you know, veneers before that aren't happy with how they look, that want to have like a more natural look afterwards. It's really easy to make. It's not too difficult to make veneers, but to make them have that like lifelike kind of texture and look, and the bounce of the light, that's really important to get right.
Yeah.
So yeah, when I first got this machine, one of the things that I realized is that a lot of the restorations that it would produce, unfortunately, they didn't have like the look that I was used to for a dental tooth or a crown, even from a dental lab. And so I spent, you know, the first bunch of years investigating that. You know, I went to America for a conference where a whole lot of other nerds went to, and we sort of all, you know,
Yeah.
yeah, and we were sort of like sharing our approaches and stories and like what had worked for us and what hadn't, and that was actually a really great experience. And there I met a guy, his name's Roland, and his company is Diashine, and like I'd never even heard of that company before this conference, and I'd been polishing almost all of my restorations for a while at that point, but I didn't have the right tools to do the job the right way, but no one like was educating dentists at that stage on how to do it. So I sort of knew I had a problem, but I didn't know how to fix it. And so I met him, and his products just, it was like an epiphany, this moment where I met this guy, because here's a guy, family company, they've been making exactly what I needed. Like exactly what I'd been looking for. You know, if you've ever got something in your mind's eye and then you finally stumble across it, and it's just this, you know, pure bliss moment. And I just remember sitting there in the lecture hall, and like all these other people are milling past looking for free stuff, and I'm like, this is it, guys, this is all you need. So he makes really great products. I've done some videos with him actually since then, some of his like how-tos on his website and that sort of thing. Yeah. Yeah, look, it's just really, I couldn't practice without that. The other thing that lets that edge be so crisp, Dave, is it's actually the spray. You can get it with a lot of scanners, you can get it pretty close to that, but even here when you don't have that level of contrast definition, you still can see the difference between them, so you can actually manually just, and I tend to pretty much almost manually pick where my margin is if I'm ever, you know, close to in doubt, because computers can do so much, but then you gotta just give them a bit of a hand sometimes. The thing about using this machine is you've got to change your view a lot. It's really, really important. So the first thing that you have to unlearn is using, you have to use a single hand. And actually, to be honest, I don't have my setup here because we've got the cameras and everything in the room, but normally I totally get rid of the mouse. Like there's like a trackball on it, and I just use a mouse instead because it's a lot easier. Alice, do you want to go check in with Dinah that she's got Michael's lunch order or juice and that sort of thing? Here we go. 3 more to do. Yeah, mate, I'll call you when we're ready for the next stage.
Okay.
Am I inspiring you to get back into dentistry, Dave?
I never left, mate.
You never left. I know it's your first love. So from here we're just going to keep marginating, then we're going to do some design work, and then there's a little bit of work after this which is all about just those final texturing details. And then we furnace them. Probably do a bit of glazing for this case as well. Polishing is one way you can finish them and you can add texture. You know, a natural tooth doesn't have stains on it when it's first, well, when you first have it erupted, but over time they do get that way. But Michael has a very specific aesthetic demand. Like, he wants that cool kind of looking, and cool has a few different contours. Aesthetically, it's associated with like a bluer kind of tinge. So he doesn't want a warm look to his teeth, and to ensure that, we're going to be using a medium translucency glass ceramic. This is the first thing that we'll do to get him his cool shade, and then we're also going to use a glaze, an overglaze over the top, and I'm going to mix that overglaze with a bit of blue and a little bit of purple actually, and those colours, they don't dominate, so he's not going to have blue and purple teeth. That would be really strange. But what it will do is it will just devalue that warmth, and it will give us a nice, yeah, nice light, slightly bluey, cool shade. Should be awesome. Sometimes the process of making someone's veneers means that we need to get to know those deeper things that are important to someone. And I was sitting with Michael, and he was after one of our consults, and he was just showing me something on Instagram, because he's quite busy on that platform with his school and that sort of thing, and just the extent that he went to refine some of his images, it gave me a real insight into, you know, how aware he was of things like shade and colour and tone, and so we could, yeah, it meant that I was definitely able to envisage what we were going to need to do to bring the case to life for him. All right, so that's the last one. We've got everything marginated now, which is important. So we're going to slit that through to the design phase, and what we actually do is we don't do one tooth at a time. We want to try and cohesively design all of the teeth together, but there's a few little things that we need to do to make that optimal. We don't want to, you know, waste our time in the process. So just waiting on the machine now. We've got to get those other views working for the next live stream, I think, Charlie. Have the context shot. No, we'll have, like, we'll get one with me in the side and then this. I think that'll be good. All right, so that doesn't look too bad, but it also doesn't look too great. So how can we make this, how can we improve this? So what we're actually gonna do is go back to the model, and we're gonna make some changes to the articulation, which I should have actually done before. I didn't check this. So what this actually does is, this is sort of the setup of how the ideal teeth would be. And you'll notice there that we've got Michael's teeth articulated nicely, because we took a scan before we started the case, just after the gingivectomy. So that's where the red bits are. Now what we're going to do is we're just going to move that incisal edge back to its existing position. So this is where Michael actually had his incisal edge before. And then we're going to try and ideally replicate that, because he doesn't want to have his teeth any longer than they were to begin with. There was a little bit of discrepancy, if you had a keen eye, between the length of his central incisors, but it's literally like at 0.25, a quarter of a mil. It's really, really quite minimal. So at this point where I've got the teeth in the corridors lined up, I just have a look at a reference image. I like to do this, and then that allows me to plan just a little bit better. So by reference images, I mean, this is what Michael wants to look like. That's what his teeth look like at the moment. So I'm just making sure that in an ideal image, I've actually produced the same. So now when I look back to the other program, I'm happy that those two are lined up And this is sort of like a visual thing that you need to do case to case. Good, I'm happy with that. So the next step is to, so now that we've saved that, we're actually going to redesign the teeth. So the automated design for veneers is not ideal, okay? And so the first design that you see, we're going to spend, you know, a good hour or so refining that and making sure it's ideal.
This is my friend Karina.
Hey Karina, how are you? How you going?
So look what they're doing.
Yeah, you're on a live stream as well,
we're
Karina.
live streaming.
Yeah, you're
As we speak.
yeah, you're all part of the action.
How good is it? Look at that. So this is my actual mouth.
Show and tell with Michael. Hey girls. So we're making teeth.
I know, we're making it all happen. Karina's gonna come visit later this afternoon
Awesome.
and check it out. Yay! It's so cool. Oh, I feel like such a hillbilly. What time do I come back in?
What time do you come back in? Oh, you've probably got about an hour or so.
I've got an
Yeah,
hour.
hour and a half maybe.
Hour
Yeah.
and a half.
All right, so I'm gonna carry on here with the design, and you'll see that this design is sort of a bit outside of where we would want the teeth to be.
Yeah.
So we're gonna pull everything back into its correct position. I'm gonna get rid of that constrained option.
How exciting.
Yeah.
Very exciting.
Cool. So yeah, so I've got like a bit longer to go. About an hour and a half of this.
Check that.
Manufacture. Yeah, good on that.
Premolar width matters, isn't it?
Yeah. So we just got to get we have to get everything right, but the pre-molar width, you're right, is really important.
That would be the
It's like a limiting factor of the case.
yeah.
Because if we don't get
how much breadth you can build on.
if we don't get the premolars right, then everything else is not going to work.
Haven't got a lot of heat.
But we will get a lot of improvement in the premolars just by doing veneers, because they're actually they're tapered quite aggressively towards the gingiva. So
Sure.
just by even doing a veneer, we can correct a lot of that, which is good. So this is the first stage, but there's more adjustments that we do shortly. Look at that tooth, is a bit strange.
Is the red the bite, Murray?
Yeah, but that doesn't matter in this phase, because
You
this is
muck
just
around.
like an initial positioning, and then we're going to do the design refinements after we've spent some time here. It's really important to maximize your time in this section of case design. So we want to line up those margins with where the ideal inverted commas tooth would be. And this view kind of starts to give us a bit of a better idea of that. So we're just going to save this case for the moment, because what I'm going to do next is just see if I can improve the orientation of the jaws. It's not at the place where I want it to be. I need to save the case because I don't want to have to redo what we've already done. Cool. So if we go back to the model, what we're finding is that this needs to actually be down a little more. Let's see how we go with that. That shouldn't have redesigned everything, but sometimes it does. It's not a lot of stuff to redo if we have to. Nah, it's going to recalculate our proposal. So what we'll try and do this time, so that we don't have to do that again, is just have a really quick look at the jaw position. See, that looks a lot better. It's a subtle but important difference. Group a few of these together. So we really want to try and line the teeth up with the margins as much as possible before we commit to the case design.
It's a trap for young players, is it? If you...
Oh yeah, because it's just, it seems like this is a very arduous part of the process, and it's just the fact that we're doing so many teeth. But yeah, it's important to get right. And you can already see the change in the design just from what we've...
It's like the importance of the primary impression. Everyone sort of thinks, I'll do a quick primary and then I'll do a secondary impression. That's the one.
And I'll get it right. Yeah, it's like, no, don't mess up the primary.
The primary is...
Oh yeah, because you did a lot of that, right? A lot of dentures.
Yeah, my dad was a real maestro at dentures, actually.
I remember seeing that video that you guys had done.
Yeah, he taught me. And he was big on the primary impression.
Oh yeah.
And it worked, and it's worked for a lot of dentists in the group, actually. They've picked up. I've gone from...
That's his legacy, right?
To some degree, yeah.
The primary impression.
Oh, just the whole process. There's more to it than that.
Yeah.
It's very much the old school way of doing it, but you know, there's many a grad dentist, including myself, have come out with a questionable knowledge of full dentures, and then that's...
I benefited from that.
yeah, you know, by the end of that, you're knocking out like 99% without issues. So that's what you want.
I think it's a really important area for dentists to get education on, to be honest. It's yeah, it's often overlooked, really. Especially when people start to look at things like implants or full mouth, and if you don't understand how to make proper dentures, it's very hard. It's the same with my dentists with like larger cases.
Yeah.
If they want to do that sort of thing that we're doing here today, you've got to be able to use this software to do the back teeth. You've got to be able to do single units to a high level of proficiency. Because that's sort of like your bread and butter. And I think that's probably just universal, right? With knowledge and all the rest of it. Get the basics right, everything else becomes a fair bit easier.
Gee, that height's going to make a big difference to my...
Yeah, the gum height.
Yeah.
Yeah, it will.
This allow a much more natural smile.
Nearly there. This canine's pretty okay, but you can see the contralateral one is just a bit further down, and we can pull it back, nestle it in slightly behind the lateral, which is ideal. I really wanted to keep quite a taper to Michael's canines, but he's influenced me to not be too aggressive with that, so we'll see where we end up. Now this tooth here is not looking too great, but I'm hoping that after it finishes the automated next step, it's going to improve. Dave, would you be able to get Dinah?
Yep.
Gosh, that's a really funny looking tooth. I wonder how they separated that. Is there, okay, I just wanted to make sure that we got Charlie some lunch. So maybe from across the road at Woodbox or a wrap or something. Oh, that's where she's gone to get Charlie something to eat? Okay, great. Just let me know when it's in. That again. So we generally want to start by getting the general position of the, that's showing Spotify, do you know that? Oh, okay, cool. I was confused. Okay, cool. I was going to say. So generally want to start by getting the body of this anterior aesthetic correct, and then move to clarifying the back teeth and then start to mill them out. So you'll notice that there's very little change between the last screen and this screen. And the thing is that we want to minimize the amount of time we need to spend at this time getting ideal anatomy. There's lots of tools that we can use to do that, but this is ideally how we're going to be able to process the case pretty much same day for Michael. Cool. There's a little bit of work to do. We knew that, so that's fine. Just looking at it from a few different angles here. Alright, so I'm just going to probably start with the centrals. So what we're going to do now is we're going to overlay the other teeth, okay? This overlay is really important because it allows me to see the length that I need to get Michael's teeth to, and they're way too long. So we can actually modify that all back, which is really, really easy. We're just going to take and group a bunch of these teeth together. So again, Michael was happy with the length of those, so we're going to bring them back.
Sorry, bring back.
All right, so we see when we did that, we actually influenced the shape of the teeth a lot because we had elected to keep the contacts the way they were. So we'll try and undo that change, and then we'll let the contacts stay as they are. Still going to change it. So we'll just elect. Okay, so we'll use a different tool. So there we go, we're able to modify many of the teeth back at the same time. Now let's get rid of that upper jaw. Oh, sorry, we'll get rid of the biocopy. Take this group off for a second. Okay, so we're getting closer, but we're still not quite there, and we want it to be really spot on. Anything you need, mate. Let's have another look. So if we look at Michael's teeth here, we can actually see that this tooth was a little bit shorter, okay, and we've articulated that the same way. So we're looking at his image this close up. So we want to actually make the correction, and we'll use that using a grid. So we're going to slightly lengthen this tooth because, again, if we look here at his previous teeth, we can see, sorry that that image gets a bit burly, that this tooth's actually a little bit shorter than the other one. Okay, so that's what we've intended to do, and it's really good to see that that's come up as well. I'm going to take a little bit more off those centrals, but I'm pretty much at the point where I'm not going to take any more off them, and then we're going to start to refine the actual appearance of the teeth. So we're basically going off this incisor that I'm working with here. All right. So now that we've finished the grouping, we're going to go to individual teeth and do some refinements there. Again, I've got to really respect Michael's desire for the length to largely unchanged with these front teeth. That's really important for me to get right. And then also we want to see a fair amount of ceramic on these canines and then the premolars. That's all good. Now we can take this away. So we can see here that there's a large body of ceramic. So what we want to do is we want to bring that back. So again, we're going to do some grouping. And we're just going to gently reduce the teeth. They all have the same kind of appearance, so if we can bring them all back in the same movement, that'll be very advantageous. So as that tooth has come back, so too have the others. Now we're going to stop using the group function and we're actually going to dial this all in together on its own. So you can see that that's unfortunately created that kind of shape, but we can, that's not a problem at all. We can get rid of all of that. Let's start with the centrals. Take that group off. Increase that strength. Let's get rid of some of that aberrant, some of those aberrant shapes that are hurting the viewer's eyes. I want to keep some of the shape of the canine, but it is a bit too aggressive. Now you'll see that as I dial back this canine, you'll see what happens. We start to get a better idea of what that shape's going to look like now. Now what we need to do is throw back the upper biocopy to see, and this is really positive. So Michael doesn't want to change the, he doesn't want to add too much tooth structure here at the front, but he does want to add it to the canines. So we want to be seeing a bit of burn through of the original veneers here. That's quite positive. So it means that we're not adding too much bulk that Michael won't want. Let's just go back to what we were doing before. So we're just going to carry on and just fix these. Sometimes the computer's great, other times not so great. Helps and then it hinders. But overall, we can produce these things same day for patient. It's really great. Pull this one back quite a lot. Just fix the shapes there. All right. See there that there's something strange going on between those two teeth that we can fix later. And this guy here, he hasn't even had what you would call a veneer designed really, so we better get to work on him. So this guy's going to need some to be pulled out. There's actually a tooth hidden in there somewhere and we need to we've still got our contact point there for this premolar, so there's no need to overly concern ourselves there. That's going to be too high. But we do want to make sure that we have the right anterior appearance of this tooth. That's really important. So if we throw back the biocopy, you can see there's a lot of ceramic on this side, and that's exactly what Michael has instructed us to provide him with. Doesn't want it over contoured back here, but yeah, he'll be happy with that. So now, one of the things that we find with veneers is that we need to sometimes change the shape what a veneer looks like from the front because of we want to close these gaps. We also can't have the teeth too long. No one wants a spiky tooth at the back of the mouth. Would you like a spiky tooth at the back of the mouth, Charlie? No, sir, no one wants a spiky tooth. So we've got to consider that as well. Copy there, that's good. Great, so just gonna check the contact points there for those posteriors, and then we'll start the process of milling them out. That's fine. We know that we can actually make that veneer because of how it's appearing at the cervical here. You're just going to add a little bit so that the ceramic is nice and strong in this portion of the veneer, because we don't want that to be so weak that it can't mill out. So we're going to use the computer in a second, so we're going to go through to the other view. The other thing, great. All right, so now we'll just check the 2-4. There we go. So we still have a contact point, so we don't need to bring in a contact point on the back side of this veneer. That's unnecessary. That's what that mark that we just got rid of was. You can see there's still connection between the two teeth, so we don't need any additional or artificial connection between these two teeth. That would be silliness, wouldn't it? Great. So let's just check that one last time. So we really didn't take too much, if you remember, at the preparation stage off these edges. So we're adding quite a lot there for Michael, so you can be happy with that result. If you zoom out, you can see that as the, let's have a look at the retracted view. Previously, these teeth came right in, they were very tapered, but now they're not as tapered. They almost have they've got a much more vertical look as compared to this oblique look. So that's very, very important in what Michael's wanted. So now I'm happy to go ahead and mill these ones out. So Charlie, we're going to go through to that other camera feed soon, which is going to be pretty fun. We don't want them to be bulky though and in the way. Great. So we'll start with this one. So we're going to take this one through and then we're going to continue the design of the rest of the case. Yeah. So I'll just, have we got the right blocks already? All right. So this is the machine where all the magic happens. In my workplace, so COVID safe, allowed to take the mask off, fortunately. Now, we have the block already preloaded. It's just material we're using for Michael is BL2MT. It starts its life out purple, and then it ends up tooth colored. So I'm going to pop that in, we'll get that started, and then we can keep designing the rest of the teeth. All right. Do the other premolars now because we've done what we're really looking for is that symmetry. So if we put the grid back on, we'll see that these ones are far too long. So we'll dial that back. We'll find the other one here. Dial that one back as well. Now if we can produce a little bit more body in this area, that will be somewhat of an advantage. So we'll just try to just improve the amount of body in this portion of the veneer for Michael. Some people might say I spend too much time messing around with these things, but I tend to think that it matters in the longer term. All right, so now we'll go back to this guy. Again, we don't need contacts. So all we're doing really now is just getting the ideal shape of these teeth. So what do we want it to actually look like? So we want to fill out those buccal corridors. That's what we'd like to do. It's the most important thing for us to do for our patient. What'd you get for lunch, Charlie? Bacon and egg sandwich. They still made you one from downstairs. It's good. There you go, breakfast of champions. I feel like I need the tunes that we're listening to and the Spotify in my ears. I feel like I'm missing out on the tunes. Just throw this biocopy in. So you can really see there, if I put this front tooth in and I take away the biocopy, you just see, if you look at the back, if you look at this area here, that's how much of a change we're eliciting. So it's quite substantial. So it's probably almost too aggressive now. That's what I was just checking before I undid some of that, because you still do want to be able to see the molar behind this tooth. That's actually quite important. So I'm just going to just dial that back a little bit now. We want to be aggressive, but not too aggressive. Let's get rid of this. Signing some paperwork, signing my life away. All good. Thanks for that, Dave. Man, how good would it be if we had a small view of like a GoPro inside that? That's what we'll do next. See, this is what happens when you come here, Charlie. I get the creative juices and they just flow, mate. It's all thanks to you, pal. Appreciate you. And Russell, tell you what, isn't that man beautiful? He's just a lifesaver. Just, have you shared the stream with him?
Not yet, no.
You should. He would love to know that America got a mention. So what I tend to do is just continue to go to revert back, just to make sure that what I'm going to do now . All right, I think the next one's ready there. So we're going to throw this 2-4 through. Hey Dee, do I have a nurse who's able to help me with these so I can keep designing? Thanks, mate. So this is the 2.5, and can you put another one in and then press play for the 2.4? Another block? Oh, cool. Yeah, excellent. Thanks, Dee. Excellent. It should, when it closes, it should get it ready to press start if you just hang by it. Oh, actually, no, it's not that. I need to click OK. All right, starting up that next one. So now we're going to get to, oh, yep, it's telling us to start, so that's good. All right, 1 to 5 now. That one that you've got in your hand is the 2-5, that's correct.
And the next one.
2-4. So we're going to go from,
5.
well, no, they will be different each time, so yeah, we'll
Okay.
have to check it.
Right.
Great, great. All right, now let's just make sure the contact of these ones is fine. So we don't want to see heavy contact because there's already a contact point there. We don't want to have the insertion of these veneers held up for any reason. So we just over contour that back, which is fine. Just happy with the appearance here. Small changes. What we can do is we can actually bring back the inside here. What this does, it actually makes the tooth appear more like angular, so it won't seem as rounded at that edge there. We can now also increase the length here, and that gives the veneer the appearance that it's closed and closer to the tooth in front, which is often aesthetically what patients prefer. Now we'll move on to the canines. Okay, so Michael's brief for these again is that he wants more of a vertical kind of look. If we look at the prior model, so we know that we're going to get more vertical if we've got ceramic material here because they were over contoured before, which is what we see from here. So we just got to make sure we get the shape of this right. Canines are my most favorite tooth to work with in the mouth. I really think that it's important to get canine shape correct. So if you're looking just to watch the insert, probably about an hour and a half, I'd say, and then we'll be back. So if you want to set yourself a reminder and tune back in then. Otherwise, if you like the technical stuff or if you're working, you've got nothing else to do, you're more than welcome to stay and hang out. We're down with that, aren't we, boys? Super down. I think he's going to be really happy with that edge. It's just the process of, with these teeth, just checking, rechecking, checking again, checking, rechecking, going back to the, you'll notice that I keep going back to this view. There's a lab technician called Weston Hatcher. All time, if you are a dentist and you want to do these kind of cases, you're happy not to do them same day, and you want a lab technician that's going to get you the best aesthetic result, you need to look him up. Weston Hatcher Design, he's a legend amongst men, that guy. Interesting enough story about Weston, he wouldn't mind me telling this, but he was about to give up being a dental lab technician for one reason or another. nearly threw in the towel because he was working for his dad, and it wasn't necessarily just working for his dad that caused him to do that, but yeah, he nearly gave it up. But then he started his own business, and he's doing really well. He's actually in California, and every now and then, I used to use Western a lot more in the past, but he's become so busy and successful that he doesn't need my work so much anymore. And I've got a lot of cases that I like to put out that we've actually worked on together. I've just been very busy, but his work is just phenomenal. It's also a new lab starting up in Brisbane. So if you're in Australia and you're a digital dentist and you're really looking at these kind of cases and you'd like to, you know, give some great results to your patients, you should look that lab up. It's called Premium Dental Lab, and a bunch of my colleagues are doing some really great work there. Really great work, and they'll be able to help you out, especially if you're a digitally integrated dentist. But some of us, we like to do it ourselves. and this is how we do it. I should stop singing. Really should stop singing. We're back. So we're just milling out the next unit. Our last one has been received, which is great. So we'll just go through the manufacture screen. This guy here, all done. All right, so we're going to start that off. Cool. That's all sent away, Diana. You'll be able to press start on that in a second. Okay, so where are we up to? Let me get these centrals right. Guess that looks a bit strange, doesn't it? Definitely want to get rid of that. It's just overbuilt that bit of tooth quite substantially. So what we're going to do first is just smooth this all out, because there's been some sort of digital artifact that's been induced. After we get rid of this digital artifact, then we can actually go ahead and create the case. And unfortunately, it has manifested itself all the way over this margin, which is super not fun. sometimes it freaks out, but that's okay. We're not giving up today. Okay. Awesome. So let's just check. All right, so we've got a little bit more buckle pronouncement of the lateral. We're gonna bring that back a little bit, but actually we can't because we need it to be in line with the central. So we're gonna leave it as it is. And we're gonna fix the central. Just going to close that. It's a bit loud out there. You see, we get quite a substantial difference just from widening that out. A lot of this we have to now do by hand. Cool. Now we're not there yet. I just want to check my grid. And I also not just want to check my grid, I want to check the biocopy. So we're pretty much spot on where the other tooth used to be, but we don't have the exact right aesthetic contour, but we're getting pretty close. So that's really encouraging. We also haven't changed the incisal length of this tooth because that's what Michael had before and we want to replicate that. But what we need to do is get it more squarish like the other one. That's very important. Why did I take that away, Charlie? Why did I take it away? Everyone's like, this Charlie. Amazing how long sometimes it takes just to get to this point in a case, you know. Okay, so this tooth is missing something really, really important. It should have a lobe in the middle. It's like a line of enamel which just runs straight up this way. So that's all we need to do. We just get this additive tool and we can recreate it. So if you ever lose it in your anatomy, you can add it back. We don't want it to be too pronounced for Michael, so we're going to smooth back at the same time. And there is also another anatomical tool later that we can use to add that again. We are meant to have another one actually in the lateral, so this is also a great view for refining parts of your anatomy this way. I'm excited by views. Different views. Just going down this, just softening it. So what I'm doing with these tools is I'm changing my area of impact. Area of impact is the yellow tool, whereas the well, a lot of the tools are yellow. You'll see a lot of the tools are yellow. That's just what they are. What we want to try and do though on this canine that's the 1.5 done. All right, sorry, just had to make sure that mill is going. So we've finished the 1.5. So we've going to put it onto the 1.4. In America, they call them different things. Would I be able to get you to do me a favor and remove the sprues on all of those for me really carefully? Mm-hmm. Thank you, that'd be awesome. Yeah, go for it. I'll show everyone this on the camera, but because they're so small, we actually had to print out and laminate like a chart to keep track of all of the veneers over time, and we just put like circles of blue tack onto it, and that's the best way we've sort of found to not lose them at the moment. But ultimately, when we go and etch them and prepare them for the mouth, there's other clinical things that are useful. This means that we don't get them all messed up, because it's pretty hard to identify the difference in the mouth between a 1.4 and a 2.5. I may or may not in my youth have cemented the wrong veneer on the wrong tooth. Great, we're getting there. If we look at this side only, it's starting to look half decent. I'll just get you to close that door if that's okay, and maybe take that through to the lab, the lab to do. Thank you. Actually, it could show the camera what you're doing. We could, yeah. Why don't we do that? We can put we can pop you on there, and then you can show people how you're removing the sprue. So all you have to do, Charlie's just use that. Fine. I'll use the light just so you don't have to change any exposures or anything. That'd be helpful? All right, I'm going to get back to this. So Alice is going to show some of the things that we start to do to modify like the sprue and that sort of thing. Because when they get milled out of the thing that makes them, they're not quite perfect. Okay. Do you want the light off or on? Off. Would be better? Yeah, cool. Cool. So if you just stay in the exact same place, so say you give yourself a mark and you lean against it, because he's going to zoom in on it, then you'll be able to. So your camera's there. So yeah, there you go. Look, you're a pro. Absolute pro. And if you want to see where it's focused, you can just look there. There you go. Excellent. Look, it's the team effort. Yeah.
My hair.
That's okay. I'll move back a little bit. And then you can take it from this direction if you want. Might be a bit easier. That's the thing about having mad awesome hair. It does. Cool. You happy? If you're happy, I'm happy. Thanks, Alice. It was really great. So meanwhile, I've just been doing the same old, just designing. Yeah, great. If you find that easier, I don't mind if you want to do it here. It's kind of good for people to have something else to see every now and then, you know what I mean? And because you're so good at it. Honestly. No, it takes a steady hand, hey? Like if you mess up, you're like, don't mess up. Oh yeah, like baby small. Oh, when we need them, we need them. We'll get them soon. Probably can't ever spend too much time finessing the design of someone's front teeth. You can see the difference between the two, Charlie. My goodness. What if we let him go home like this? Probably would have no patience the next day. So let's get the grid back, because now's when we need to start looking at the proportion between the two. So we want the total area that both of these two teeth to take up to be the same. But there's also some limitations in terms of the biology behind the teeth. So at the moment, I feel like we need to move slightly this, oh, that wasn't very good. Let's go back here. So we want to move the grid to be slightly here and then have a slight amount of overlap on both sides. So now we're just going to work to achieve that. Which isn't too hard, which is good. So we need to draw this one out. We'll just check the biocopy while we're here. That's basically our incisal edge. We're very close to it. We can bring it, oh, using the wrong tool. We can bring it back. Two directional. You can bring it back slightly if necessary, which I actually think it will be. So we really want to respect what Michael said about he wants to keep his incisal edge the same. You can always take a bit more out after they're milled out, but you can't add more. And there's also a parameter which takes, I think it's 150 microns off the top of these. So we can make them just a touch longer and it won't actually affect it, but we can't make it, you know, too long. This one, based on the design, is shorter. So we want to make them even. So that's all good. Okay. So now we've got our grid going. Get rid of the biocopy. Now we've got to start cutting this one back. So I'm looking at the other side here. I'm looking at the width, I'm looking at this area here. What does that tooth look like? How can I replicate that on the other side? Now, I know we talked before about not actually being able to produce perfect symmetry, and that is the truth, but we can still use what we see in our mind's eye when we think about symmetry to our advantages. So we can still achieve, I would say, a greater degree of harmony by the pursuit of symmetry in aesthetics. Until the machines take over and they can actually make us the same in every way. Which probably won't be that great. Cool, so now it's starting to look like something that isn't going to be terrible. I'm really happy with the design of these two. I do want to tape that canine, but he doesn't want me to, so I think we'll just have to leave it up to him. Let's bring it in just a touch. It's better. Cool. Keep moving. Get back to our center point with the grid. All right, so we need to Square off. Squaring off incisal edges is actually, it's actually really an interesting thing. The tools don't necessarily lend themselves to it too well, but you can do it. Just take some practice. That's why we practice. The words of MJ. So now I'm looking at the incisal edge. I'm looking at the differences between this incisal edge and this incisal edge. The grid is very, very helpful at this point. Now I'm looking at the differences between this curvature and this curvature. And there's a very gentle difference between them. Pretty much bang on in terms of the edge of the incisal, but we've got to do some pretty significant changes to the teeth themselves. Hey, you're back. What are we after now? So you've got the 1-4, okay, we'll at the 1-3 then. Great. Looks like a nice man though, central. Hopefully it mills out okay. Great. 1-3 on the way. So we got 1, 2, 3, 4. We're halfway, we're nearly halfway through. That's good. Better than temporaries. You know what I'm saying? Much better than temporaries.
I agree.
No one can see. This is so interesting. Don't stop people from seeing the interesting. Is Dee out there with the blocks and stuff? All right, well you just get the block set up and then, yeah, just gotta press the start button on it, that's all. If it's not working, let me know. Something definitely happened on this incisal edge. It's like strange. Yeah, something in the, either in the acquisition. Let's play it up. It's okay. It's hopefully not gonna. That one's milling, the 1-3. Great work. want a seat, Alice? You might want a seat. Great work. So these red areas, red, yellow and green, these are basically where the teeth are traumatically touching each other. The light blue is where we've got minimal thickness of material. We don't want to have that, so we're trying to build it back. And use the various tools to be able to achieve that in the mouth, which is good. And sometimes, especially in the centrals, when you get to this stage of the case, there comes a moment where you've got to give some and get some in return for that ideal final design. So it's really important to take your time, in my opinion, to get this right. Yeah, so it's much smaller now. It's 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. That's much wider. So we're going to bring this one back. Yep. Get rid of these areas where we can have ceramic exposed to tooth. So we want that ceramic to be nice and strong, but it's also difficult sometimes because we've got to get the right shape. So it's just about understanding the differences. It's pretty similar. So this. Now, let's just remove the grid. We want to have as much symmetry as possible on these front incisors. It's really important. see we're adding this tertiary anatomy as we go as well, because the other teeth that Michael had, they didn't have any of that. Like, Michael doesn't want to have the most natural teeth, let's all be honest, but he does not want to have teeth that collect the light. He really wants to make sure that he can expose that. Have that light bounce back. It makes your teeth look bright and really nice. So I know that matters to him. You don't have to, this is not the only way to do what I'm trying to talk about here. There's actually a more efficient way, but I'll show you that tool in a second. But the problem with these surfaces is when I started the case, we had all of those artifacts. So I'm trying to, at the same time as produce the case, I've been actually having to get rid of those artifacts at the same time. So it's a good case for everyone to see, because it actually hasn't been like a really easy one to process. There's been a lot of issues in terms of the design, and it's good that we set aside some time, because yeah, if you don't have that, you can't. What do you do for patients when going gets rough? Or is it tough? I can't remember how the saying goes. So always resetting back to that initial frontal view, always, again and again and again. That's what Weston showed me. That view becomes basically the setup for the entire case. Without setting up back to that frontal view, you've got very little chance in being able to just reproducibly find this point. So setting up those models earlier is just critical in being able to do that. Try and get rid of some of those odd artifact-like shapes. Get these incisors looking as similar as possible. Bring back our grid. Okay, so we just want to check. So we're a little bit deficient on this side, that's okay. We'll probably instead move things this way. So we'll just, what we want to do is get a nice large tool and move. See, as we move this way, it evens things. So now what we'll do is we'll look at the contacts and just make sure they're not too aggressive, and that should pretty much be done with the centrals. Some people say it's a fair bit of work. That's probably correct, but it's fun, and I think it has allowed me to understand aesthetics and dentistry in a whole different way, processing these cases myself. Like, I originally bought this unit because I really struggled finding a lab team that I could use, that I would, getting consistent results with. And to be honest, I think the problem with me, I think that my dentistry back at that stage was actually not quite good enough. But for whatever reason, what happened was that I adopted this 3D digital technology and really never looked back. Very humbling to begin with. Like, really had to work on a lot of aspects of my dentistry. One thing that you'll notice is different to me than a lot of other dentists is I don't wear those glasses and loupes. It's because of something with my eyes. So I have, and it's interesting, like out of having those things that you can't do, sometimes it pushes you to do other things differently, and that's been just part of my journey. But yeah, definitely having, you know, labs that I had, let's just put it nicely, look, they weren't bad labs, but I just had issues getting the results that I wanted for my patients. And so I thought that the simplest or the correct solution would be, oh, I'm a clever dentist, I'll do it myself using, you know, a digital approach. Boy, was I wrong, you know. It wasn't simple, but it definitely in the long term, I think, is worth it, and it keeps returning to our patients. Digital labs are now everywhere. So most dentists, if they know it or not, they're actually getting teeth for their patients that are made not necessarily with the same software, but the same way. So for a long time, I would, you know, speak at courses, or I would tell people digital dentistry is the future. But it's just really the standard, I think, now. In Australia here, we probably a little bit behind the times. So it might not be as adopted, but it's like comparing a Tesla to a normal vehicle. They just don't really compare. Having said that, the analog approaches, there are parts in that we always will continue to use. We respect very much. You know, I still use the cording technique. It doesn't change the actual core way we approach our dentistry. I think that's really important to acknowledge. Thanks, Alice. Everyone loves it when you come back in because you get to show some cool stuff. Unlike all the stuff I'm showing, no one wants to see this junk. Everyone wants to see Alice. Super weird how this artifact. This case has been full of like little digital nuggets to fix. It's been great, yeah. All right, I'll just get you, oh no, you can, do you just want to get Dee to maybe do it, just so you can keep doing that? Oh, okay, no, sorry, yeah, just stop that for a second and just put in the next one. Just so we get that going at the same time, sorry, I should have remembered. Okay, so 6 of 10.
Rusty said it looks good, mate.
Ah, thanks, man. I really appreciate that. What a ledge. He's like, doesn't sound good though. You're not using Sennheisers. Those Rode mics. We're just having an in joke. A production joke. It's great. It's powerful. Not your area. All right, I got 1-3 coming through now. Very good, thanks Alice. No, it should be 1-2. Hang on a second. We've already done 1-3, what are we doing? Goodness gracious. Okay, it's 1-2, we're going 1-2. 1-2. Okay, gosh. It's not bad audio. Oh, I'm glad that we did that. honest. Yeah, he's got great taste. What's his Twitch stream? We get everyone to follow Rusty's Twitch. He plays mad. What does he play? Call of Duty. He's a Call of Duty player. So if you're a Call of Duty player, look out for the baker. All right. So centrals are fine. Now we got to work on this lateral, which is not at all fine. We'll get there. Is that his? Oh, he's actually watching the stream right now, so he can hear what I'm saying.
Yeah.
That's so funny.
COD and Apex.
COD and Apex. Anyone wants to play, he's up for some action. Extreme 893. Imagine if instead of going to school, Charlie, all you'd done was make gaming content for YouTube. How successful your life would be.
Not that good, so.
Yeah, I mean, but like, it's pretty amazing the world that we live in now, right?
It is.
I'm doing the canine because I can't really do the design for the lateral without having the canine behind it, so. See, I know you see, but I'm just telling everyone else. Just letting them know. It's pretty fast, hey? Considering like we had all these digital fix-ups that we had to do. Goodness gracious. Oh, thanks, Alice. You're so nice. She's so nice. I've got great staff. Honestly, makes my life such a breeze. So difficult to work on cases like this if you don't have a great team. I'm blessed. To you too, Charles. He's in my phone as Charles, and his name's Charlie, and it was all my fault. I just couldn't find him the other day, and I got really sad for a second. And then I messaged his girlfriend, and she's like, here's his number. And then I looked, and it's the same number that I already had. I already had you, Charles. I had you the whole time, bro. We were always friends.
Always.
Here we go. What do you reckon, Charles? How's that canine looking? It's pretty good?
Looks great to me.
Looks great to you. It's a little bit long. We might just dial it back a bit. So I'm comparing it to this one here. It's actually pretty fine.
Rusty said, unreal how you can design these teeth and crown in the same day. You're world class, Dr. Murray.
Oh,
High praise.
I praise. I think he's biased. That guy was like one of my first patients of all time. He's literally, you know, when I was in, literally got a photo. I should put it up on social media. This guy like trusted me as a student. You know, this is like 10 years ago, and yeah, it is actually insane like how fast time goes. I feel like it was like yesterday I was living in your house, just freshly moved to the Gold Coast. Yeah, man.
I remember you living with us.
Don't you? Oh man, we went to the pool together.
Were you there when Jack bumped his teeth?
No, I was not there for that. I probably would have been involved in helping to fix that if I was there at that point. No, was not there for that. Yeah, the jack teeth throwback. That was the moment. Yeah, we've been able to do like crowns the same day for a really long time. Like this, being able to do a full mouth of veneers though, like I'm not gonna say it's really new, it's pretty new. It's funny, I saw on YouTube like a couple of weeks ago someone who'd done it in the States. And I was like, that's awesome that they're able to show people that. But yeah, we've been doing it for a while. You just got to make sure your computer's fast enough, because if your computer isn't fast enough, you just get bogged down, because there's a lot of data crunching going on behind the scenes from the actual PC. And then yeah, you're basically fine. You've got the right computer, you've got the right scans, and you have to have an integrated workflow. A lot of people, they go, oh, I've got a scanner. And the problem with just having a scanner is that if it doesn't have an integrated workflow, you're really gonna just waste your time. Like, I don't know. In some respects, it's easier taking an impression, right? And then handing over responsibility to someone else. But you get additional controls if you're happy to go through what we're going through today. And you can get a result that you're by and by going to be more like happy with. So now I'm just checking the contours. So I feel like I've got a little bit more of an aggressive contour on this guy, so I'm going to broaden it out a bit, which is important because I need to add a little bit more width to this lateral. So it's all coming together. We are getting quite close to the end of this case now, which is, well, we're getting quite close to the design part of the end of this case. Dave has gone. If anyone was wondering why there's no more questions, our question man has left the building. So Charles could try, but I also do not want the stream to crash, so I'll leave it up to Charles. Yeah, there's lots, but not with the veneers. It's just a bit too, you gotta be a real nerd. Like, it's a bit of a small club, but there should be more, you know. There should be more. So what I'm doing here is I'm actually thinning out that incisal edge so it doesn't look so rounded. So if you look here, you can get like a rounded look to the canine, and it's not as aesthetically pleasing. So we just like to have that a bit sharper. Just looking a bit better now. Well, it's not so much about, thanks for all the questions, man. So it's not so much about protection. Like you would have to have you're not gonna go and do this procedure to protect your teeth unless you had teeth that were like damaged or aesthetically challenged to begin with. Or, you know, yeah, so is it done for protection? Not so much. But then you get instances where, for example, someone has worn a lot of their tooth. So if someone's worn their tooth a lot and you've got to build it back up, well, there's no better option really than a digital addition, because the thing about digital is you literally can measure how exactly do I want to build this person's tooth back. And that's a big advantage nowadays that we can do that. So you're not going, oh, I'm going to add on a stone model a certain amount in wax. You actually can measure with the computer. You've got the two next to each other, so you can do your additions. So yeah, that makes it pretty strong. I don't know if that answers your question. I'm pretty bad at answering questions. Thank you for asking them anyway, Russell. It is good for strength. The thing about these ceramics is that when they're supported by a healthy tooth structure and you've got enough thickness, they're really very indistinguishable nowadays from natural tooth structure. So it's kind of like you get the strength and you get the aesthetics. But they don't have the flexibility, so you know, even natural teeth break if you get a horse accident or, God forbid, some other things that happen to people. This is the last bit I gotta get right. I know, Charles, we're nearly there. Oh, you're a good guy. Yeah. Yeah.
The next book's in
Great. Do the 2, 3. Can you just let Alice know, Dee? Because she'll be doing the sprue removal for us.
Oh, great.
Thanks. Yeah, we answered that before. So it's all about how long, yeah, so, you know, how well are they looked after? And is there trauma? Those are the big things that matter when you're looking at how long will someone's veneer last. Debond is the most common complication of a veneer, and now with digital veneers, we have the advantage in that we can just click and remake the debonded veneer. So say you lose it, the material will just last. Like ceramic is really, really strong, especially the modern ceramics. They're really hard to break. Some of the older ones, they were a lot easier to break, but these days it's pretty hard to break the ceramics that we have. Actually got those numbered correctly yet. So, you know, I hear people say things like, you know, 10 years. For me, I've been practicing for 10 years. I haven't had my early cases come back and need to be replaced. I've had some cases debond, but that's normally because of a functional problem. So the patient might clench or grind their teeth or something like that. And so there's ways that we can deal with that. We can do a more circumferential preparation to the tooth, so we can use the same digital design and then wrap more ceramic around the whole tooth, so instead of just a part of it. And that can normally avoid having those issues. So they're the longest lasting thing that we, like dental apparatus, dental treatment that we provide. They're generally very well tolerated. If you look at the research and you look at patients that have had, you know, other treatments. So for example, say they're missing teeth or they're unhappy with their teeth, and you offer an elderly patient dentures, and then you review the elderly patient over time to see how they're tolerating that treatment. They won't review it very kindly. But if you give that patient like a crown, which is made very, very similar way to what we're making here in a veneer, or you give them an implant, so something that's fixed, they're very they have like really high quality of life. So it's really something that's well tolerated, and that's because it's fixed. It's in the mouth. It's something it's just like your natural normal tooth, and putting something into your mouth like a plate or some sort of prosthesis like that, it's just not a normal and natural thing to do. So. this distal side of this, it's probably a lab technician watching this stream right now being like, this case was really fun because all these little bits that I'm having to do now to like even issues that they're just not normal. So if you've ever wanted to know how to troubleshoot when doing digital design, this is the stream to watch as a dentist. It's always good to learn from the hard cases too. Like if you see a dentist with experience struggling or finding something a challenge, that's always good as a young clinician. You can learn a lot in those moments, you know. When the oral surgeon's there trying to get out a wisdom tooth and he's finding it difficult, that's when you're getting the ultimate amount of value, because there's a difference between an experienced surgeon finding something difficult or challenging and not being able to do it. I don't think someone with, you know, considerable experience in their area of deep knowledge will ever be in a situation where they won't be able to do what they're, you know, trained and done, you know, thousands of times before. But the way that they navigate their challenges is really interesting, because it shows, you know, their deep knowledge in a unique way. So when you can learn from that, it's really powerful. All right, let's get this lateral sorted and finally figured out the back of that central. Yeah.
So let me just move all that down.
Let me see. Yes, yeah. So that square or rectangular bit that you see on the front of the lateral, you can take that all the way down.
Okay.
That's totally fine. Thank you for checking. Very good. All right, so fortunately it's got this really big bulbous bit, so we've obviously got to get rid of that. Like, imagine having a tooth in your mouth. Anyone want a tooth like this in their mouth? It looks amazing, right? So we're gonna it's got like a protrusion. It's a protruded tooth. So definitely got to sort that out, right? That's literally what I'm dealing with here, guys. I'm dealing with it all day. Thanks, computer, for making me look good. Well, technically it kind of does, because it was such a terrible initial design. As long as Michael looks good at the end of it, that's going to be the litmus test. But no, I'm really happy with how the aesthetics of the other units are turning out. So, and sometimes, you know, if you're digital dentists out there and you're watching, you got to do this. You got to be able to spend the time on the case that it needs. There is ways to I feel like in the scanning maybe, or something has happened here that's strange. No, it wasn't the scanning. It's probably when we... Oh, that's not a good sign. All right, so it's going to reboot. I think those other units are saved. It does save every time it goes to the mill screen. So we're going to cross our fingers and hope that we don't have a case that is interrupted halfway through, because that would be really unfortunate. It was when I was like fixing that hard section too that it decided to, yeah. Oh, good. Sorry, mate? We'll see bleach and trans. Do we have any of the try-ins? We should have got some because we were asking for them a little while ago. If that's going to stay at that waiting screen for a while, you might want to switch up the view. All right, so, okay, I think it undid all of the changes that we made. So, okay, no, good. So we've still got, the case is pretty much the same. We've just got to still fix the distal of this central, and then we can fix the lateral. So, everyone take a deep breath, it's okay. It's not as bad as we thought it was, or it could have been. Oh, we've got our Humpty Dumpty back. Let's fix this Humpty Dumpty. Have you shown it to Jess, Charlie?
Yeah.
She's loving it? Oh, that's great. Nice. Love Jess. What a ledge. Okay, getting there. Still not right. Oh, hang on. So what's milling out at the moment? We're gonna be like that 2, 3. Hey Alice, so we got the 2, 3, has the 2, 3 milled out? That was the last one. Oh no, it wasn't yet. So the 2, 3 hasn't milled out?
It started, but
It stopped.
yeah.
Can you press play?
No, it's like still like on the you.
Oh, okay.
Kind of figuring it out.
All right, so we might need to redo that one, so get another block for that.
Okay.
Just check if it starts now.
Okay.
How far through is it, Alice?
It still has 6 minutes left.
Yeah, we'll start again.
Okay.
That's all good. And that's the thing. If we can just make it again. Same thing, same difference. Fortunately, it saves between each step. Very important.
Yeah,
I have had an instance where things were not actually saved, and that was very sad. You may need to turn the mill off and yeah. Okay. All right, well, we're just going to go to an intermission for 5 minutes because I need to pee. And then we're going to get back to it and we'll have the veneers getting glazed very soon. So it's going to be extra special. All right, I'll see everyone in a sec. Right, back into it. So what is this still part 3? We're still in part 3. We haven't dropped out of part 3 yet. This is good. So Alice is just loading up the mill. Did not terminate correctly. Powered down the milling unit completely to start to try again. Just check that she did that. So, did you turn it all the way off? Did you turn it all the way up? Did you turn? So you didn't turn it all the way off. Just hold this button. And if this doesn't turn off, like just holding it, then we got to turn off at the back.
Yeah,
Just-
that's fine.
It's not turning off, is it? All right. Bad technology. Bad. All right, now I'm going to get my muscles out. Although, we might be able to get away with doing it the easy way. Oh, yes, there's a cheat way. Off. And is there a certain amount of time that you're meant to wait for off? No? You reckon it's good? 5, 1, 2, 3, 4, 5. Good boy, please work now. All right, that's better. So we'll leave that, I'll leave that with you, and I'm gonna scooch back around and try and get it to mill out that unit for us again. Be good? Oh yeah, good, I got the view now. All right, we'll press start on that. says it's still configuring. All right, I'll leave it here. Just let me know how it's going. So we'll keep designing in the meantime. That stuff will sort itself out, I'm sure. Well, I'm hopeful. I'm certainly hopeful that it does, because otherwise Michael's going to have a strange looking mouth. Woo! Well done. We are cooking. Okay. So where were we up to? Let's have a look at the central here. Yeah, so we've done a fair amount of that work. We've just got to get rid of this line. You don't really want an invaginated line. That's such a strange word. Gosh, that's fun. So it's funny, I tend to stick to like not the most latest version of software, not the latest version of car, not the latest version of most things in my life. And for stability, I'd chosen to maintain this older version of the software that we're using today for the design. It just so happens that it has played up a few times. I like irony. Nearly at the point where we can stop reinforcing this terrible line. Just before. I did actually. Let's redo it. Let's look. Very good. Starting to get there. So nice to hear Maddie there in the other room. Patients just love her. She's such a nice way with people. All right, let's just check that we didn't change the aesthetics there. So, yeah, all the proportions are unchanged. So now we can just handle it. Let's save that because we did have a crash before, and we'll be able to mill out the 1121 pretty confidently. You don't really want to be going and making any design changes. You'll see that I don't make design changes to that we've already milled, because if I do that, then I'd have to re-mill the restoration, or worse, I would think that I'd made changes to something and I'd actually milled a different version of it. So yeah. Nearly there. Starting to get the body look a little bit more natural. So now we're going to look at the ridges. terribly anemic. So one of the things that we have to do is make sure that we keep changing, and we'll get rid of this grid just for now. So we want that light to reflect. The thing is that it's from a different direction, so even if we add the correct ridge shape, we might not see it. That's a bit better. You can just start to see that line angle appear, and it's just the prominence. There we go. That's much better, hey? Starting to look like a tooth. I'm digging it. Man, I've definitely got to get a version of that audio next time. I gotta get a version. I can't even hear myself speaking, which is super weird when you're live. All right, so we gotta tie this lateral now. Let's bring back the grid. So we gotta tie the lateral. Okay, a few things we gotta change. The first thing that's super obvious that we need to change is we've got to get the length right. So the length, let's put the incisors on this line. Yeah, so the length is wrong. So we need to get the length the same. So let's use the shape tool that we used before. Just bring it back. It's pretty perfect now. And that means that this canine to incisor relationship is better, but it's not ideal. So the other way we're going to fix that, because we can't change the canine because we already optimized that, is what we do is we're going to just tuck this incisor just ever so slightly in behind the central. There you go. Love it when a plan comes together. And you just see there's a big difference, you know, with patients that want that tighter relationship between their teeth. That's often, you know, what they're after. Cool. So they're looking pretty similar from above. We're nearly there. Now, after these are milled out, there are further adjustments that we can do that are all, but none of them are additive. So it's just really important at this point that the dentist just takes time to make sure that there won't need to be any changes that would require adding anywhere, because we can add after this point. It's really, really difficult to do that. Bring. There's something happening here on this edge. Just need to soften it just a little. That's looking pretty close. I like that. I'm happy. There was a big void. If we look back at this photo, look how deep that triangulation was. I think there's actually, which one was it? Which one showed it really clearly? Look at that. So yeah, you can see by that one, he just had a big deficiency there. So just building out this incisor this way will have really, I think, enhanced the overall aesthetic for Michael. What I might do is go, no, that other one's still milling. We're pretty much done now. Just check the contact points. Just got to take a bit off this one. It's off the back side. And then a little off. Easier with the two. Easy. Easy, boys. Nice. Actually, I don't even think that we need a proper contact, do we? Oh, gosh. No, it's better to have some form of contact because it's kind of contacting further back. So, no, it's good to have that contact. It's going to be see, these are the details that your dentist goes to, right between the teeth, just adding ceramic, where you would never even think that you needed ceramic. We got you, got you. Charles is like, Murray, you need to calm down. All right, sweet. Pretty happy with that, so let's go to remove the grid. Oh, final, super critical and important thing. You can add it by hand if you want to, so I've pretty much been doing it like that for this case. But we want to make sure that we have all of those lobes in place. So this one's good, this one needs it. We don't want it to be, we want it to bounce the light, and these ridges, they help to bounce the light. So how are we going to do that? We're going to take away here, and then we're going to take away here, and you just see it just appears straight away. So, and we can just smooth out if it's a bit too much at all. Just use the smooth tool. Sweet. Let's have another look there. Pretty happy with that. So now what I'm going to do is I'm going to go get Michael, and he's going to get the final ability to make adjustments just with these front teeth. So I don't know if we should do some sort of reveal thing with him. I'm sure he's going to be excited regardless. Let's just have another look. We've got the biocopy. Just checking everything now for a last final time. We probably have just added, just going to bring a touch back on those centrals. So just grouping them now. Just got the anatomical tool in 2D. Just going to gently nurse them back to exactly the same as they were before. So there's no change in the length of his incisors, which is what he said. Very clearly. I keep saying it, but it's important to him. So, yeah. Now we'll bring back the grid. Just there doing my final checks. Save this, that just got really, really buggy and I got scared. So they're taking the sprue off these, so they're doing 2, 3, so we've just got 3 more to mill after this, but we'll be able to start the process of glazing pretty much straight away, and everyone will be able to see that, which will be awesome. Cool. Yeah, I'm happy with that. I think those aesthetics are fine. Now, the last thing that we do is we're going to group up a few of these teeth that we haven't milled out yet. And we're just going to do a bit of a variation to what's called the incisal edge, which just means that we add a few more textures just before we send it through to the mill so that we have to do less by hand later. Now we don't have to do very much by hand because of the way that I do the digital design. In fact, we basically don't have to do anything. But what we're doing here is we're going to be adding, so I'll just show you, that would be the variation if I put up to 100% strength. But we don't really want to add very much at all because I've already added most of that by hand. So, but just to see the different types, I'll take it to about 50% and then go through the variations, and you can see there's all these different sorts of anatomical variations. Now obviously I've overstated them, but generally I like to do the fourth one first, only at like 10%. Okay, so that's going to give me a bit of incisal edge variation, consistency in my anatomical profile. So I'll apply that, and then what I want to do is I want to go through to the fifth one and do the same, but I bring it up to about 12%. Oh no, 3 to 4%. 5%, no, 4%. Yeah. So that's just adding additional striations here. You don't see them like that in the mouth. They're just really, let's make it 3. Really just subtle textural additions to the tops of the teeth. Okay? And you could ask for those to be like more aggressive, and it does look strange if you don't look at teeth a lot, but you won't see it. It's just going to allow more light to refract off that area of the tooth, so you see more of someone's tooth when they smile. So that's been applied as well. Pretty golden now. So let's go get the man of the hour in, show him what we've done. Hopefully he's happy with it, because if he's not, then I'm going to feel bad. Take this group function off. Sweet. All right. Do you want to show the... Oh, no. We'll be back in just 1 second. Hey, Michael. Hey, Michael. Oh, he's okay. Do you want to message him and just make sure that he knows that we're all ready for next stage?
Do you mind if I have a little peek?
Oh, totally. It's going to be great. I'm just going to check. I'm literally... Yeah. Okay. So I've milled out most of the veneers.
It's my friend
Karina. Gosh. Michael's beautiful, and then all of his friends are beautiful, and it's like, my goodness, what do I do with this level of beauty? Great, great, great. Come through. Come see the digital veneers and the design and everything. We've got to get a new one put through, if that's okay. Oh, we can video it up. That's totes fine. So we're back. We're being right back.
Wow, this is Karina Burleigh. Hello.
This is Karina, who was on the video of Michael's phone before.
No, she just did.
She's joined us. Maybe we should. Do you want to try that one? The top one. Okay, cool. I'll move this out of the way so we'll have a bit more space.
Wow.
So if we're let's just do the full. Oh, goodness gracious. What am I doing? That's right. So this is what we had, what we started with. So there's a few really important things that we didn't want to mess up, right? So we didn't want to go any longer. And we've actually done a bit of a gingivectomy today on the 4-1 and the 3-1 because you wanted a bit more length in those. So we could have added a bit more length, and I tried to get you to let me do it, but you didn't want to. So we did the gingivectomy on the top, which is good. And so what we're going to expect now will be this. So if we look at them now, and then we look at your originals, the really important thing that we see from here is that you actually had a little bit of a size discrepancy between your two front teeth. I actually didn't write about it in the workup that we did, but if you zoom in, this tooth is just slightly short. It's like a 0.2 of a millimeter. It's like 200 microns or so. So what we've actually done is we've actually corrected for that. And it's amazing, like they're actually quite nice looking teeth, and you look at them in the scan and they sort of look, pretty terrible. So this is what they're going to be looking like now. Look how much longer, you've got all of that additional length. We've closed this gap that used to appear on the side. So
Oh,
getting back to it. So I just have to show it with, So remember that gap?
Mm.
Goodbye gap.
Bye,
Goodbye my lover.
And this one.
Yes. Yeah. All the gaps are gone. And also look at how vertical I made all of your back teeth because you wanted them to.
Cool.
So you've got like, it's really broad now. So it's like properly can smile. Like probably more than I wanted to, but I do respect you that much because of who you are that I wanted to make sure. So that we've pushed the boundaries on it. It doesn't seem like a lot, but remember, they were really tapered in. So I can actually, I think I can show you. Yeah, like these areas are burned through of where your other teeth basically were. So this is where you wanted addition. This is where you wanted addition.
Yeah.
This is where we wanted a lot more. And so we've got it all in
Wow.
those areas. Now lengthwise, just so you can see, I know it looks like it's a lot longer. Trust me, when I started, it was like really long.
Yeah.
So let's see if I can't actually fade it out, but your natural tooth is just there. It's like, it's right there. And the mill will actually mill it just a little bit less anyway. So this is absolutely the exact same length as your teeth at the moment.
Awesome.
No additions. Murray hasn't come in and done silly things. No, I know, I totally get it. It's so important. So the other thing is we haven't changed the width of your centrals. So I designed them to the same because I know you were happy with that. But the things that are different are now we've got a bit of texture, and I haven't made it too aggressive, and now it looks a little bit scary when you look at it on the digital file. But now, oh my gosh, what am I doing? Don't even know what I'm doing. Got like all these tools running around. So you can just see, I don't even know what that is. Okay guys, I'm sorry. It's getting away from me. You can just see the ridges on these areas here of the teeth.
Yeah.
And those ridges, they're basically, like if we look at the way that light refracts, that's going to make it look natural, but at the same time, because with the whiteness we're using, they're just going to be really awesome, amazing white teeth.
Awesome.
That's it. You happy?
Is that them there?
That is them in process of being made. So we've got to do a few more and then, yeah.
They look really white there.
Yay!
Well, that's actually the purple stage. So they're going to change, yeah, from purple to white.
Cool.
But you're going to get to see me paint them and we're going to glaze them together and it's going to be, yeah, really exciting. So I've probably taken an extra hour and a half because I had a few setbacks in the computer, but I'm really happy with how the design turned out. Man, if you had seen them earlier, I think you would have totally lost confidence. Like it was pretty bad. We'll watch this like fast forward the stream to when I first start working on it on the computer, and you'll be like, it's terrible. Like it will look so bad, yeah. But it's just part of the process, so it's good.
No, I trust you.
And it's so good that we could do it same day. Like how much better is this than having to come back again, right?
Yeah, it's crazy. It's so cool that you can do it.
Yeah. It's funny because I only told Michael that yesterday on a Zoom call. So we're talking about, I'm like, oh yeah, this, that, and the other, super relaxed. And oh yeah, and we're gonna do it in one day.
That's amazing.
Because I thought I was going to come back next week.
Well, mine took 2 weeks when I had mine done. They're so cute. Look at them.
Yeah, there's little teethses.
Little toothies.
That's right.
Crazy. Yes, they look so beautiful.
Yeah, they're gonna be awesome.
That's
Cool.
exciting.
All right, so I'm gonna start glazing them now. So that's
Awesome.
gonna be pretty fun.
Well, we've got, like, I'm going to make another little fun video.
Okay.
What's this process?
This is just sort of me like secking them out and that sort of thing.
Cool.
Just so I don't lose them. I don't want to like cement the wrong tooth in the wrong place, you know what I'm saying? That would be ultimate bad. All right.
Interesting roof to look at. I like that.
Yeah. TVs. Lots of
All right, so let's bring this round.
Oh, I love watching all this. How amazing is the experience? She's a personalized experience. Very.
All right, so don't need this. I don't know why they gave me these.
Yeah, because we're actually in Pop 1 U.
Oh,
Extra.
extra veneer. And more.
I want a second
second set above.
Yes.
Second
so
set.
when I really smile, people are like,
You want your shark teeth. You want your shark teeth. That's what you want.
Have you ever had a patient who said, I want to have like sharp teeth?
No. No, I've seen things where people like do weird like on, you know, Discovery Channel and they become lizards and stuff. It's pretty gangster. I'm not that cool. I'm definitely not that cool as a dentist to enable that with my patients. Like I'm not allowing anyone to do that in this practice.
No vampires?
No vampires allowed. So, are you gonna?
You want to go on that one?
Yeah. So I'm setting it up. All right.
You want to pull the light
You want the light to be? No, that's the light there. That's the light. So you want it closer or away?
away. Is that
Yeah,
right?
that's fine, mate. Totally. All right. So what we're doing now? You on me?
No.
Up, up, up. Cool.
Nice and tight.
You can go way more zoom than that. Just waiting. Way more than that. Yeah, there we go. Cool. So it'll just be on you to just, yeah. Very cool. Yeah, closer, closer, closer. It's pretty dark though. All right, so what I'm doing is I'm just adding a little bit more texture. You can't make it any brighter than that? That's really dark, bro. No, don't bring the light in, that'll wreck it. It's also not very focused. Just look at my lovely fingernails. Don't,
Do a manicure after this.
yeah, you can hook me up, bro. It'll be sweet.
Get your teeth now.
So, just repeating. This is the point of adding those extra textures, but it's not the be all and end all. A lot of it comes from that design phase that we did before. That's the most important part. Great.
So this is like shaping a diamond, pretty much.
Yeah, there's not. How come?
And are you happy with it?
Yeah. Why wouldn't I be?
Just before, like a little bit of like square.
Ah, yep. She's very.
You didn't get the bottom one, hey?
That's the area where you get a lot of natural texture.
Yeah, it makes it look more real.
Cool. And then Charles, don't worry, I'm coming back. Don't lose me now. All right, so now I'm going to do some glazing. It's going to be great. And I actually will get a chair for this because otherwise this is like quite hard, quite difficult to do. This is nothing compared to your level of artistry, right? But this is a nerd dentist trying to do some artistry. But the colors, they really do matter. So we will generally start. Oh, can I get the loader so I can load this? Like we'll generally start when we're glazing a veneer, right? So we'll start with like a neutral glaze, and that's what this is. This product is actually by a really cool company that they infuse the glaze into their shades. So most of the companies, they'll do like glazes and then they'll do shades, and you kind of got to mix them yourself. But you know, being a dentist, I don't have time for that. So yeah, GC make this cool glaze that I like. All right, so what I'm gonna do is first I'll load up, that might not be enough, thanks. So I'm gonna load up all of the veneers around, but I wanna load them up in the same way that I'm gonna put them in the mouth. So imagine that you are this disc and you're facing like that way. So I'm gonna put the 1.5 to the 2.5 around that way. And that's important for me so that I actually don't forget like what I'm doing. It's amazing how small these are. Like if you don't like have like a way to do it, you'll stuff it up. So I don't want them to touch that the disc. That's really important. So
is that so that when it goes into the machine to cook, to heat up or something?
So the disc is just to hold them, because you can't hold them in your hands, obviously, when they go in at 800 degrees. But and not everyone, like labs think that this technique that I'm using now is abominal. Like they're like, why? But the thing is, I actually don't want to get any of the glaze onto the margin. And so what I want to do is the force that I'm putting onto this super peg ceramic firing support, it pushes out and around the margin, so it sort of supports it. So there's no way that I can get glaze up and underneath when I'm applying it this way. So that's really important to me. And that's the reason I use this technique. Some dentists would be like, sacrilege, but hey, rules are made to be broken, aren't they? Can I please have a diamond tweezer?
And some diamonds, please.
Lots of diamonds.
It's so cool being able to like see the process from start to finish.
Oh yeah. Well, to me, it's kind of boring now, but I can understand that. It's really nice of you to be able to share what you're doing with like lots of other people. So that's super good. So do you still wear your mouth guard at the moment?
I used to, and
Yeah.
I dropped it in the toilet one time
And then
years ago, and then I was like, oh, unsalvageable. Do you know what was actually really funny about it? Is that I tried to wash it, and I put it on hot water, and it melted.
that'll happen.
Yeah, now I
You'll be
don't.
sleeping with a mouth guard every night now.
Yes, exactly. Do you wear a mouth guard?
Every night.
Yeah, yeah. See, I used to.
I'm scared I'll grind off my teeth.
That's what I was really scared as well, yeah.
So now I'm
I
gonna.
said that I'd done pretty well with them. Like, I kept them open.
Oh yeah.
How long has it been since you had yours done? No?
2018.
2018, yeah.
But I didn't get to watch everything.
No.
Seeing them look so little and frail is so scary.
It's crazy, hey?
Because they're just
Like
like a
so
little
much-
fingernail.
So much time. But you think if you were this big, a small change would be a really big change. So it's like we're just giants dealing with these tiny little teeth. And if we get the smallest thing wrong, it has a really big outcome. So you kind of can't have a blasé attitude as a dentist, because if you do, you'll make a lot of mistakes.
I feel like I notice it as well. Like I'll see something and be like, oh, it's a millimeter out. I can see it in photos and together.
Yeah.
Almost too much sometimes.
Yeah, in an annoying way.
Yeah, 100%.
I just can't wait to see 12. Is it 12?
We did
No.
10. Yeah.
Only
The
five.
next
Yeah, I had the bars done.
Yeah,
The-
no.
the next tooth along is really quite a crazy tooth to do this to. It's like a molar tooth. This is quite. Yeah, people do it, but it's a bit rarer for people to add a veneer to a molar tooth. I do have some patients. I haven't done it myself ever, but I've got patients that have been seen by other dentists that have done that. I probably would really try to encourage whitening and maybe not go back that far, but depends on the situation. Some people have really bad staining. I showed you that video of that young guy that had really bad staining on his front teeth that we treated here. Imagine if he had staining like that on any of his back teeth. You'd probably want to get them veneered as well. Like, braces won't fix that. Cool. Okay, so now is the time where I get to play with the colors. So I've kind of already mixed a bit of the blue into this central one. Can I get some of the refresh liquid, please? From the silver pack. You can bring both of the bottles. Yeah. So yeah, but I'd say you should get 10, 20 years out of them at least. And then what happens is most of the time people actually decide, oh, I don't actually really want to redo them. They're fine. Like, who has natural teeth at the age, like, perfect teeth at the age of whatever anyway, so they're not too much of an issue later on. It's just you electively wanted to replace these. Like, there was nothing wrong with the ones at the front. So we could say, oh, they only lasted 10 years, but that actually wouldn't be accurate.
Yeah.
Because they were going to last, like, how many years are they going to last? They're probably going to last 30 years. So, yeah. And you can see, can you see the brush marks on these? Like, it's just so clear, that extra texture that you get from the brushing. It's really good.
How frequently do you recommend that people should visit a dentist?
Gosh. Look, everyone's different. I think 6 monthly checks aren't a big deal. I think that everyone should probably do a 6 monthly check of their teeth and gums. That's kind of the industry standard. That's what most people's health funds help them out for. So like if you have health insurance, it's pretty easy for you to get 2 checkups and cleans a year. Sometimes if someone's got really good oral hygiene, they can probably push it out to like once a year. One of the things that we see that's a bit of an issue is just removing the sprue here. Get nice and tight, Charlie. They get implants or they get like major procedures, and then they think, oh, everything's fine now. It's like, no, it's not. You've got to come back. Maintenance is so important. I'm just going to change that. I'm going to do some more glazing. No, that's done. Oh, I was just making sure. It could have been essential. These make it so much easier. I was trying to do it before with my fat fingers and like it's failing epically. This glaze is really interesting too. Like it dries out. So if you mix too much of it, you're just gonna have to remix it. So I only ever mix a certain amount. But you really do see the coolness in the shade if you use these blues and the pink. We're just going to run over everything at the very end with that special polisher that I told you about from Diashine, the one that I got from America, that I worked with that guy. There's no point in using that before we move to the next step. You're happy that they weren't too open, not too like nice and closed.
Yeah.
Anything more than that, it's like you just like have a block. It's cool. We're getting there. Nearly done. It's very exciting. Just got to do 2 more. So what we might do now is I'm not sure if we should cut the stream intentionally or if it's better to you want to zoom out on that one? Cut the stream intentionally, or if it would be better to perhaps I'm not sure if there's anything else that we can go over about yours. We've pretty much gone over everything up until this point. We're not going to furnace these individually. We'll wait until they're all out, and that just means that we're going to save time in the furnacing process. So it's going to take 10 minutes for the next veneer to mill out. So probably in 15 minutes time, they'll be finished. And then from there we'll furnace them. And so we'll probably be back in about an hour, ready to cement them in the mouth. I got held up in the design phase today a lot, so all those people that are chiming in about now, when I said earlier, I was like, oh, come back in an hour and a half and it'll be fine. They're like, he's still not ready. So, all right, we'll do it that way. Okay, guys, so we'll be back in about half an hour or so with the finished veneers ready to put into, oh no, about between half an hour to an hour with the finished veneers ready to put them in Michael's mouth. Be fun.
Yay.
Bye. Oh yeah, so we just finished sandblasting Michael's teeth. We've done his try-in, so we know that he's happy with how they're looking. And we're just preparing them now for bonding. So this is the moment of tooth.
Yes.
I cannot see the stream, Charles. You keep leaving it on Spotify for me. You keep leaving it on Spotify for me.
Time to bond.
Time to bond. Time to bond. James Bond. Yeah, that's it. So just hold that down as you do it, because it will pop out. Yeah. Cool. Just go just water to begin with, and then do both afterwards. Sorry? Oh, my other one before that. Moment of tooth, right?
Oh, that's glorious. Moment of truth.
I thought we'd be done by 2:30 today.
Oh, stop it.
I got a friend who calls himself Agent Molar. He's a dentist. Not even joking. He's basically taught me everything I know as far as dental jokes are concerned. Oh yeah, well, he's all time. All right. So now what we're gonna do is we're gonna put like a cleaning solution on the front of the teeth. You okay?
Mm-hmm.
Can I please get the No, I'm just gonna need a micro brush. Cool. Can't close until the end of the procedure because we've rinsed off that stuff. Is that okay, mate?
Mm-hmm.
You stay open for us now. And generally, not that it does too much, we're just trying to ensure things a little bit here. If we drop anything and you swallow, it's going to be a couple of days before we can continue the procedure. So it's up to me not to drop and you not to swallow. That's the deals. You managed to get all the red stuff out, hey? Mm-hmm. Yeah. She's just onto it, right? Just time after time after time, exceeding my expectations. Oh, where's that bond at? Just do that again while I do the bonding. Yep. Teeth, glorious teeth. Have you tried that other view at all?
Yeah, a little bit. It's
Grainy.
yeah,
Oh, okay. Why is that?
just a slight bit of distance.
Big difference, eh? No, it's cool. I trust you. Just helps me understand how far we need to space them. You alright? Mm-hmm. It's doing great. So this is the bonding phase. I'm just making sure we've got more than enough on all of the bonding surfaces. Let's take that out, let's get that away. Okay, now we're gonna, just in a second. Alright, we're going to cure those. Yep. Sweet. So the bond is all set. Now we're going to put the adhesive on top, because basically what the bond does is it allows the tooth structure to receive the adhesive, which is the layer between the bond and the veneer. The tooth and the veneer, sorry. So tooth, there's a layer of bond preparing the tooth for the adhesive, then we've got the adhesive, and then we have the veneer. So there's a little bit to it. Okay.
Do you start with a 1 or a 5?
Centrals.
Yeah, okay.
All right. So what's this? 1, 1?
Yeah, 1, 1 and 2, yeah. Turn it down.
Sorry?
Turn it down.
I just need something to, yes. Where did you put the bond? Where's the adhesive? Thank you. Can you get those ready for me? I just need the thing, the teeth, like ready for you to give them to me. Thanks. just get some on it. Just quickly. No, I need more on that. Put that in as the 1.5. Want more? That's better. Yeah. So much for using those diamond forceps. Last one, buddy. Let me just check that last one. I don't need any. No, that last one needs more. Yeah. Okay, hang on, I've just got to see how they're in. Gosh, look how sticky my hands are. Cool. All right. Is this already gelled? Yeah, this is already a gel phase. So let's get the I'll just use this one actually. Oh, no, I can use that. No. Take it. You need to get the things. Thanks. there. It's not in focus, Charles. Oh, it was just my hand, wasn't it? I'll leave that out. Suction. Okay. Is it secure? Actually, I think that they'll be right for this. Let's just start here. No, we're gonna cure. We're gonna cure. Feel more comfortable. Now we're setting it. Setting the sun. Weird, all the different lights. Are you curing both sides?
No, I'm doing
Okay. I'm weird, I do them both. That's why I've only done half as many as you. Mine is not working. All right, so this is basically it. All we're going to do now is just clean up around the gums, but we're pretty much there. So everyone pretty much can see. That's fine, just do these two now, because they have to be at least cured on the front, and if that runs out of battery, then we're giving you a lot of trouble. So this resin that we use is actually a dual cure resin, and that's why I didn't actually need to tack cure the front teeth. So dual cure resins mean that when we mix them together, they actually start to set, and that's obviously a big advantage. So we've done the dual curing, which means they have a chemical cure, but we're also setting them with the light as well. We take a lot of time to set them with the light because we don't want the setting of the adhesive to be the reason why it debonded or something happened to it. So we don't just rely on that chemical set, we want it to set with the light as well. Cool. All right, so it's pretty exciting. Let's get the, just gonna make sure that we've got. Fortunately, the veneers are not coming off, even though it feels like it. For Michael, this feels like I'm scraping parts of his body out. Not what's happening.
Is it dried that far?
Well, it's set with the light that we use. Yeah. He's ready to be out of here. Super hard, isn't it, that resin? Doing great. Cool. Need a few. Let's get a few there. Some triplets. So that last thing that we were doing, my audio went down, but effectively what it is just a way to make sure that all of the resin is removed from between the teeth. So we don't want to have any glue stuck there. And we're going to get Michael back again to do a bit more of a clean with hygiene, but he's probably had enough for today. Just going to get the bite paper. So now we're just going to check his bite. We didn't design any of these veneers in function, but just in case something's gone wrong during the day, just biting together for us. Tap, 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 tap on your back teeth and open. And again, tap, 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 tap and open. And tap, 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 tap. And grinding around fronts and backwards, all the way out if you can. Yeah, that's it. And open. And grinding out all the way forwards again. And side to side now. And open. And grinding side to side. Yeah, that's good. Thanks, mate. And opening again. That's cool. We're almost finished. So we can see we've got function on all of the regular places we would expect. None on the surfaces of the teeth that we have just treated. Just want to remove a bit of excess bond from here. Good. Another little bit of excess here. Excellent. All right. Let the man go free.
Yay!
Yeah, you really put up with a lot just then.
A lot of dribbling.
A lot of dribbling.
Dribbling.
A lot of dribbling and a lot of drilling. Excellent work, mate.
Yay! I feel like I'm coming out of the Matrix.
Coming out of the matrix, hey?
That was good. Didn't feel a thing.
You're a good sport. Well, that's a big day. So yeah, we got held up a little bit today because of the issues on behalf of that computer, I think. We also got delayed a little bit at the beginning of the day because the wooden computer, which is my laptop. So technology has plagued us, but we got through it all, got the job done. Pretty happy with that. That's the main thing. Now, what do they look like? The thing that everyone's been wanting to see. Can we get a close-up look of that in that camera? Now that he's sitting up?
That one.
Yeah, yeah, yeah.
Hold on, guys. I'm literally dribbling.
Okay.
Hold up, hold up.
Are you gonna zoom in?
Yeah, he's got some zoom. He's got the ability to zoom.
Here it is.
We're ready.
We're ready.
Can you see it up close?
Yeah,
On that one.
Oh, on that one you can.
Yeah.
yeah.
Oh.
I'm really numb at the moment.
Just-
It's, like,
just keep-
impossible.
Keep your mouth still though. Just big smile, if you can. There you go.
Hard to smile. I just feel like I'm really
Is that on the live feed? Because I can't see it on the feed. No. There we go. Try again now. Now you can see your own smile.
Wow.
Can you zoom that? Or is that the most it goes? There we go. Happy.
Look at that cold sore.
Don't look at it. Look away.
Wow.
Yeah, it looks a lot better.
Yeah, just having it more full. You're numb now, so you can't really
Yeah,
like
it's
smile.
hard just to smile, and I feel like this whole pattern
Yeah.
feels like a chipmunk. But
Yeah.
cool.
Excellent. All right, that's a wrap. That is a wrap. Thanks everyone for watching. Hope you enjoyed learning. And if you have any questions, just let us know.